314, copy that, no worries.
34 on channel.
As daylight fades, Duty Operations Manager Brian starts his shift. On weekend evenings, the average number of motor vehicle accidents increases by more than 40%.
35, understood. I'll make a note of that.
Inspector 34, Sydney.
1C MBA for you.
Thanks, I expect 34. Dropping it down now.
Copy, thank you.
Reports have come in of a car crash in Sydney's southwest. Police have been notified and Brian is the closest available paramedic, only moments away.
You can see the car now, he's just approaching.
The driver has abandoned the vehicle and fled the scene. Brian must now track them down in order to assess any potential injuries.
Just need to find out where they are.
I'll chase it up.
Yeah, thanks. We'll continue northbound. Give you a report. Unfortunately, as paramedics, we go to car accidents, which a lot of the time, it's avoidable. By people just actually not getting high on drugs or alcohol and deciding to get behind the wheel of a vehicle. Yeah, copy that if you wouldn't mind, thanks. Police have just arrived on location as well.
The driver is located 1 kilometre from the crash site.
Yeah, copy that, thank you. What's your name, mate? Yeah, no. Matty, I'm here to help you. I'm from the ambulance, okay?
Who told you not to say anything?
Who told you not to say anything?
You never hurt me. I told you.
Who was that?
I can't say anything.
The driver's friend has also arrived on site.
What are you doing?
So what's happened, mate?
My name's on my way back from work. I got a call from his mum saying that he's had 2 bottles of wine.
Right. Mate, sit up, buddy. Come on. Hop off the road. Sit against there, bud. Sit down here. We just sit down.
No, sit down. Sit down.
No, sit down, please.
Sit down, okay?
Just do what the police asked you to do, mate, okay?
Sit down, mate. Just sit down.
So-
Sit down. Do the right thing and sit down before you get hurt any further.
So he drove the car from the house, did he? Okay. He'll go down for blood and alcohol. Buddy, don't do... Just calm down, mate.
Stop. What are you doing? What are you doing? If you don't calm down, you'll be cuffed and be thrown in the back of the van, okay?
Has he ever had a mental health assessment?
He is the high-vis.
All right. We'll take him down to hospital.
That's my town.
Yeah. So he's obviously been driving a vehicle, which obviously is another level of complexity for the police. So, all right. I've got an ambulance on the way, so. The devastation that drug causes. It changes people from being normal members of the community to just uncontrollable beasts. I've had situations that have turned from being calm to violent within seconds.
Very good, Chris.
As a duty operations manager, the first and foremost priority of managing every scene is the safety of both myself and my colleagues. Unfortunately, paramedics have been punching bags for a number of people over the years, and it's escalating. Are we taking it, or are you going to take it?
I'm just leaving there for the time being.
Yeah, that's fine.
And he runs off.
Yeah, no, I agree. We're chasing. A person who's affected by ice is just so unpredictable. You never know what's around the corner. You never know what you're going to be exposed to. And you never know where you're going to end up going home to your family. Are you here?
Yeah, kick me in the face.
Oh, right.
Mate, stop kicking the door. We're going to move you down to the paramedics now.
Duty Operations Manager Brian has discovered a young man who's crashed his vehicle under the influence of alcohol. Of greatest concern, the driver also has a history of using the drug ice.
Did you just see the melee down there? Yeah. Okay, so this is him. He has consumed 2 bottles of wine. He has previously taken medication overdose. He's just kicked a police officer in the face. He's full as a boot. The unpredictable behaviour of patients who are ice affected, the level of aggression is just extreme. All right, so you got all the restraints ready? Hey!
Wait. Stop kicking!
In some cases, the decision may be that that person's so violent, it's actually risky for paramedics to transport. Yeah. We'll hold him down and then, we'll get the restraints on him.
All right, there you come. Come on. Sorry. No, it's okay. We're not going to hurt you. But you've got to be...
Come on, mate. The ambos are just here, okay? Come down here. Come down here, bud. Just sit down here for us. Hang on, mate. Just give me a sec. It's all right. We're just here to help you, buddy. Have you taken any medication tonight, mate? We just need to know.
Tell me that everything will be okay. They told me that everything will be okay. They told me that everything will be fine. They told me that everything will be fine.
Hey, keep your legs straight.
Get off. Get off.
Keep your legs straight, buddy.
Get off.
We're here to help you, mate. You just got to calm down. All right, let's get this one in.
We need it. Listen.
Hey, we're here to help you. Sit back. Sit back. We're here to help you. We're trying to help you. All right? Well, listen. Yeah, okay, listen.
Please stop. Please stop. This is an election. Stop. Please.
I'm finding it more and more that commonly that we actually are needing to sedate people to get them to hospital to provide care. Okay, you guys right?
3, 1, 2, 3.
We're torn between a duty of care to the patient and then making sure you can go home at the end of your shift. And unfortunately, my family come first, every time. Make sure it's nice and tight. Sadly, in 28 years as a paramedic, what I've found is the ice issue in the community is increasing. And we've got younger and younger people who are actually now taking drugs. Every parent that's lost a child through taking an illicit substance would never have predicted their child would have done that. As a parent, how do you deal with that? I think, wow, you know, like I'm going to educate my kids about drugs and, you know, touch wood that I'll never be in that circumstance. Yeah, and I really hope that with the right guidance, they'll grow up, you know, to be equal contributing members of society and most importantly, enjoy life.
Oh, we're turning on to McDonald Road. You know that's a sign.
In Liverpool, paramedics Joe and Saha are waiting to be dispatched to their next call-out.
We're not having McDonald's.
You're not having McDonald's.
No. I thought you wanted Hungry Jack's hot chocolate.
I do want Hungry Jack's hot chocolate. But I'm probably going to want to eat again.
Look at that, Hungry Jack's on McDonald's Road.
It's a sign.
Ambulance emergency. Tell me exactly what's happened. My son's just fallen off play equipment and he's bleeding a lot. And how old is he? 3. Tell me exactly what's happened. The girl actually got stuck on the bed frame. She's stuck? Yes, she's stuck. Tell me exactly what's happened. I have a 19-month-old boy and he's having gastro. He's refusing to drink. We're trying to give him Hydrolat. He's just vomiting everything up. Is he breathing? Yep. When he's vomiting, he's struggling though.
8:33. Yeah, 33, we can assist.
1 Charlie breathing problems.
In Denham Court, per the column notes, it's
Gastro.
There's no original.
Okay, so he's changing colour. His hands and lips are slightly bluish. Okay, I'm organising help for you now. Stay on the line, tell exactly what to do next. Just watch him very closely. Yeah. Turn the outside lights on for us. Okay, if he does get worse, there's any way to call back immediately for further instructions.
Embos drop out of the sky for a child who's not breathing. They just all of a sudden become available and there's multitudes of them.
It doesn't matter what you're doing. Even if you've got a patient in the back, you jump
Yeah,
it.
you jump it. Absolutely you do. A high priority lights and sirens job that involved an infant always brings me back to my own family because I've got 2 beautiful little boys. They're just so precious, you know, like...
It's more disheartening when the child can't tell you what's wrong. They just know that they're unwell and they just look at you with such sad eyes.
Yeah. Little bubs. Being a father, you physically feel your heart rate escalate. You physically feel that your palms start to sweat up slightly. And your focus is so much more in tune. He's going to be sick, I think, this child. He's going to be very sick.
Father of 2 Joe and colleague Saha have been dispatched to a vomiting toddler who's also experiencing difficulty breathing.
I've had to respond to Jordan once.
Okay.
And that was a really scary experience. Really, really scary experience.
What was going on?
My wife called and he had this horrible breathing. She goes, look, I know he gets croup every now and again, but this sounds really bad.
Did he respond well with you treating him?
Yeah, it was quite severe initially, but he responded really well to the treatment. Children are the pride of their mum and dad, and they're their everything. They are their world. So for us, you know, we're handling the most precious cargo to that person. You push that available button, you just do not know what you're going to go to. It could be the most terrifying thing you've ever been to, or it could be the sweetest thing you've ever been to. Hello. You're all right, you're all right. Hello, how you going? Hi. Where are we going?
Straight in the living room.
Yep.
Yeah, come in.
No worries.
Hi.
Hello.
Come on.
This little button?
No, this one of my hands.
Oh, hello. How you going? What's his name?
Ananias.
Ananias.
He was
What's
pretty
happening
bad.
with him?
On Wednesday, he started out diarrhea and vomiting, so my husband took him to Western Hospital.
Yeah, Western Kids?
Yes,
Yeah.
and they said it was gastro.
Yeah. Is the diarrhea still going?
He only had it once this morning, but the vomiting hasn't stopped. So
Okay.
he vomited twice.
Yeah.
And he vomited again now.
Okay.
And when I gave him a shower, I noticed that his hands kind of went bluish. And I called my husband, I said, is it me or is his hands going a bit blue?
Yeah.
And then when she got him out of the shower, he just started throwing up.
Yeah.
And it just started coming.
Kept going,
Coming,
kept going.
coming. His lips went blue, his
Yeah.
hands went blue, and he started shaking a little bit.
Yeah. Well, come over here. Hello.
Maybe because you're closer to the TV.
Maybe he just wants a TV. Oh, these. Do you want these? Right.
At Westmead Hospital,
Yeah.
children's, they said to me, if he gets worse, if he's not drinking any fluids,
To call us.
to call,
Absolutely.
or take him to hospital.
Yeah, yeah.
If he vomits, just ambulance straight away.
Can I have this back for just a tick? I'll give it back to you, yeah? I'm just gonna have a listen. Is that all right? You ready?
He'll let you listen.
The little ones are gorgeous. They love paramedics. They see the uniform and they will give us high fives and they'll wave at us in the street and they'll give us cuddles. And for us, that's a beautiful part of our job. It really is. Okay. I'm sorry, buddy. This is gonna hurt.
Do this.
Oh, what happened?
Delayed reaction.
I hate the delayed ones. To get trust from a little child that has no idea who you are except for the fact that you're a paramedic is amazing. He's super cute.
We never have patients that want to cuddle us.
No, and look how quiet you are all of a sudden. Like I said, you guys are doing all of the right things. Yeah, keep his fluids up. As long as he's taking them, happy days, that's good. If he doesn't, then yes, he's going to need a drip.
What do you want?
What's this? What do you want? What's this?
Wants you, Joe.
Come, you can come.
I think we're going to have to take
Should
you
we
with
take
us.
you up? Should we take you in the ambulance? It's your decision, Mum, Dad. Like, if he will tolerate, excellent. If you won't tolerate, let's go up and get him a drip. Okay.
And knowing he's going to get a drip, I'll be
Yeah, no worries at all.
been sitting here trying to force him to drink.
Good. Let's go. Sometimes a parent runs out of options. Like, my child's really sick and I just don't know what to do anymore, and they pick up the phone and call 000. And that's probably really, really scary. Alternatively, if you wanted to pop them in the car and go to Westmead, we're happy with that, whatever you guys want. Sometimes all they need is a, you know what, Mum and Dad, you have done all the right stuff, and that's amazing. Hey, Sarah, can you pop the beacons on for us? Oh, wow. Look at that. Aren't they cool? It's absolutely gorgeous when a child makes that connection with me or any other paramedics that are there. It's heartwarming. It really is heartwarming. And you get that real human intimacy that you wouldn't get from any other job.
You got to say bye to your #1 fan, Joe.
All right. Bye, buddy. Oh, no, done. Wiggles are on. It's over.
Did you hear the couple in the Wiggles, they split up? Oh, it's so devastating.
How do you keep up with this stuff? All the best. Good luck with it all.
Bye-bye.
See ya.
Have a great night.
You too.
Much appreciated.
Not a problem.
It's our pleasure.
Anytime.
Take care. Bye.
To engage with people's families and see how much love and see how much care when you walk into a house, it's a nice thing. When we see so much bad in our job, to see that nice side of humanity is beautiful.
He was cute.
He was adorable.
He loved you.
He was
straight
absolutely
away.
adorable.
He was like, okay, we're going to be friends.
And he's going to be just fine. He just needs to be rehydrated, right? And he'll be just fine.
I think you made a new friend tonight, Joe.
It's made my night.
And his little brother, oh, I got so clucky.
Oh, you got clucky? That's good.
No, it's not.
What I was saying is that I've got multiple disabilities.
Okay. Do you have any pain?
No.
Since early this morning, a caller named Mitchell has been repeatedly phoning 000.
And if they don't understand what I'm saying, well, what's my life?
We're going to
We don't know.
an unknown problem.
Good.
So,
I love myself a job. You don't know what you're walking into sometimes.
He says he doesn't want an ambulance, but paramedics Josh and Sophie are dispatched to check on Mitchell's welfare.
Patient has had an argument with the federal government yesterday and wants to speak with someone.
Here we go.
And mentioned a history of mental health issues.
I don't think that anyone understands how much of our workload is mental health related. We could do an entire shift worth of mental health patients. Treatment for mental health is quite broad. There's medications, there's mental health facilities, there's psychiatrists, psychologists, but I think some people find themselves at wit's end, which is when they turn to us, when they don't know what to do.
Mitchell, calm down for a minute. When you call on 000, we have a process that we need to follow, okay?
No, you listen to me.
hello?
Hello, ambulance.
Yeah, I'm talking to somebody else as well. Hang on.
Okay.
Who are you?
I'm the ambulance.
Hello?
Hello.
Come in and you got to sign the book, please.
Sign the book. Not a problem. What's your name?
I've got the supervisor for triples. Come in.
Okay, sweetheart.
Do you know how the ambulance is here?
Yeah, the ambulance is there. I want you to speak to them. Mitchell?
All right, Mitchell, pass me it here. I'm here. How about you sit on...
That's my medical...
Sit on the lounge and speak to Sophie for me, please, mate.
Hello, hello.
Yeah, mate, we got this. Thank you.
Mitchell, I'm sitting over here. So what's happened today?
I have been mistreated. I have been under sort of situations. I actually suffer with PTSD. I suffer with anxiety.
Yeah.
Personality disorders. I'm 100% legally blind, and I'm going to show you something.
Don't stick your finger in your eye, mate.
Look at that.
Okay. Okay.
It's on your chest, sweetheart. Up top.
Up. There you go.
See?
Okay, you pulled your eyes out. You can pop them back in.
I might be able to see better.
Mental health cases, the only thing we can really do for them is use our verbal and communication skills.
Oh, excuse me, sir.
Yep.
Do you want to see what's in my room as well?
What's in your room, mate?
You just chat with these people. Just talk with them, try and find something to connect with them. You know, a lot of these people want to unload their whole life on you.
Aren't we going this way?
Yep.
See, I've got all this up here.
That's very helpful. Another big TV, you got a pussycat on the bed.
Yeah, that's 310.
310, we just woke 310 up.
That's okay.
That's a bit of a fold-out couch, mate.
Yeah, it's a futon.
Okay. I think the public would be amazed at the amount of mental health there is out there in the community, that their neighbour next door is suffering massively from depression and anxiety, but when they come take their bin out in the morning, they got a big smile on their face. I think people would be amazed.
So Mitchell, how can we help you today? I mean, we are here for emergency health care.
Yeah, but what I'm saying is I only get, like, support 8 hours once a week.
Man, that's not enough, is it?
No. And I am just totally pissed off of the way people are treating us. Why do disabled people go through all this shit when they're traumatised, you know what I mean?
And that's why, if you come up to hospital, they might be able to connect you with people. If you've done this already before and it hasn't worked, then I understand why you don't want to come up to hospital, and that's all you have to say, okay? But unfortunately, as an ambulance service, that's as much as we can offer you right now, mate, okay?
We'll just leave the premises.
Are you sure? I understand you're unhappy and we want to help. That's what we're here for.
But how can you help, mate, when I'm...
Do not, listen, do not swear at me and raise your voice. It's not appropriate, okay? You speak to me properly.
Well, how am I supposed to speak to people properly when I'm 100% legally blind? I wear bloody hearing aids and I'm on the Willy Walker and I fall over.
I understand that. I need you to calm down because you get
I need more help than what I'm getting.
Okay.
And I know I need it, but I just don't know what to do anymore because I've been right through the whole system and I'm sick of it.
Come on. It's okay, all
right? Why do I have to get through this shit?
Can we take you up to hospital?
No, you can't.
So that you can talk to someone about this?
No, it's not gonna happen.
No?
Just please leave me alone.
Can you tell me one more thing, Mitchell? Do you have thoughts of wanting to hurt yourself?
No.
No. Do you want to hurt anyone else?
No, unless I'm being left alone, I'm okay.
Okay.
Just let me play some music, mate, and I'll settle down.
Okay. It is frustrating, Push, you know. When you go to a mental health case and you're not as effective as you want to be, you know that you're walking out of there getting on with life. Yet that person is still sitting there with that mental disease. That person is still sitting there with 10,000 shitty thoughts running through their head. And that sucks as an ambo.
This is my stress relief.
Okay.
Okay. Let's turn it on and then we'll head off, okay? Beautiful.
All right, mate, your neighbours will love you.
No, listen to this for a second. That's me on the guitar.
Oh, yeah?
You're very talented, Mitchell.
All right, Mitchell, we're going to leave you be, okay?
Okay, mate.
Sweetheart.
All the best.
Have a sit down and relax, okay? Goodbye.
Look, I reckon he needs more than 8 hours a week.
There's definitely a problem.
Maybe get that 8 hours and spread it over 5 days or something, you know?
Just
Just have someone visit him every day just to...
He just needs someone.
He needs company. We could have sat there all day.
Oh yeah, he would have talked at us.
100%. I think a person who deems this as time wasting has no understanding of mental health, and I think it would take one day for them coming along with us on an ambulance and attending people who are mentally unwell to realise that these people don't have a choice in this. They didn't choose to be mentally unwell. Unfortunately, that is the card they have been dealt. And I would never say the mental health people are the time wasters, because the one that we think's the time waster that we don't get to is the one that we might not be able to save.
825, go ahead.
Thank you. Just advising, we've left this patient at home with no acute health issue. I can almost guarantee you that he's going to call us back.
825, copy, understood.
Okay, tell me exactly what happened. I can't, like, in the middle of the night, I've just been itching so bad. And is your breathing normal for you? It is normal, I'm really itching.
It's late afternoon at the Sydney Control Centre.
Is that blender, is it unplugged at the moment?
She can yell like that, she's breathing quite well, right? So don't you get upset. Now, is she changing colour?
As the day ticks on, calls continue to roll in.
All right, and I believe the bleeding's serious, is it? Yeah, okay, so we are organising help for you. Okay, just stay on the line.
Yeah, that would be good, thanks, Amy. We have information from the police in Bronte. Police are on scene there with a 30-year-old male who's suffering shock and hypothermia. We have information now that the patient is stuck at the base of the cliff there. 423.
43.
Thanks, 23. When you're clear, it'll be 2 immediates from police, Bronte, Calgary Reserve, hypothermia. Thank you.
Copy that. Drop it down.
To winch the hypothermic patient to safety from the bottom of the cliff, a rescue helicopter is almost on scene. Car 423 with 31-year-old Biffy and 22-year-old rookie Gina is still 10 minutes away. The full details of his condition remain unclear.
Hypothermia. It's not something you go to often, is it? I have no idea. This is weird. Is that all it says? Yep. Shock and hypothermia, that's all.
Jacinda Bronte, I'm upgrading it to hot.
Okay.
He's been in a helicopter and he's deteriorating.
Okay.
Okay.
2433, can we upgrade that to a 1 speed?
Deteriorating, is he? So patient is deteriorating with hypothermia.
Really quite escalated quickly, didn't it? The police have said he's really quite deteriorated, so 423 almost the same for this one, and we just started IC back up from Randwick as well, so that if he's quite quick, we can start extra fluid as well.
Sorry, bump.
On the way to those bigger jobs when someone's going to be quite critical and needs your help urgently, we'll always think of it as the worst case scenario. and our adrenaline is pumping, thinking what we're going to do, you know, preparing drug doses, thinking if we're going to call backup. Sometimes you're a bit frazzled, but you have to walk in with a clear mind because you don't know what you're going to turn up to. Hello.
Where's best for us to park?
Hi. Ian's just a bit cold, so I don't know what the job came through as.
They like, he's deteriorating, can you hurry up? Like, what's ETA, ETA, ETA?
Ian's just cold because he walked along the rocks and got stuck by the rising tide. He got pinched out by a lifesaver. That's as good as the job gets, I'm afraid. Sorry about that.
No, it's all right. All good.
He's just over there.
We'll just,
so.
thank you so much. Awesome.
All good.
Hello, how are you?
I am a bit dizzy
Yeah.
because of the cold.
Yeah. You want to come hop into our ambulance?
Yes, that would be
Yeah. Okay, no worries, mate. Come along. What's your name?
great. Ian.
Ian.
This way, sir, this way.
This way, Ian.
One of the traits I always say that paramedics have to have is adaptability.
Say goodbye to the helicopter.
And I think that's very important. You know, we're going there, our adrenaline's high, all we can think about is this person who's close to death, and we arrive and it's not what you were expecting.
So legs down that way and then scooch your backside down.
That's why I love it, because you don't know what it's going to be in front of you.
Is he wet?
Oh, this is wet. Do you want to take your pants off?
Shoes, maybe?
I'm kind of shy, so perhaps...
Okay, that's fine. No worries, mate.
But don't worry, I'm gay, so... I just want to have a nice walk today. After I took some beautiful pictures, I thought, why don't I go deeper? At the beginning, I thought I can just get through this because the tide was low, and that's how people get into trouble.
How you doing, Ian?
Hi,
You
thank
enjoy
you
that,
so
right?
much. Yeah, I really enjoying the lift.
It's a
Yeah.
once-in-a-lifetime experience.
Yeah.
True survival story, wasn't it, Ian?
Ian, are you a bit rattled? Did you want to go up to hospital?
To be honest, I don't think I need to go to the hospital.
Okay.
We'll take you. We'll take you home if you want.
Oh, actually, if you can discharge me, my idea is to call Uber from my phone, and I can do that.
Sure.
Okay.
You're not in trouble.
I'm strapped, so I can't reach my phone.
We trapped you.
Your patient can make your day or ruin your day.
Okay. All right. We'll wait here until the Uber comes. Yeah.
I love having a chat. It's the Australian way, I think, to have a bit of banter with your patient, with anyone, really.
I used to be a comedian in UK.
Oh, tell us your best joke, quickly!
The best one? Okay, where do fish keep their money? In the riverbank.
It's like dad joke 101.
Yeah. In one day, you get to see so much and do so much. And then to actually have our patient walking up to us with a big grin. I love this job.
I can keep all the blankets?
You can,
Oh my God,
absolutely.
thank you.
There he is.
So, thank you so much.
You're
What's
welcome.
your name?
Biffy.
Biffy.
Yeah.
Nice to meet you.
Nice to meet you too.
I'm Gina.
Nice to meet you, Jana. Have a good night.
Take care. Bye, mate.
So yeah, the patient that was hypothermic, that was winched out of the water off the cliff, is now on the ground, conscious and breathing, and is getting an Uber home. I don't really know what went on there.
Friday and Saturday nights are the busiest shifts of the week in the Sydney Control Centre. Tonight, there's also a rare astronomical event, the longest blood moon eclipse of the century.
No matter what moon it is, if it's a blue moon, a red moon, a green moon, the moon makes a difference. It sets the tone, and being Friday night, it's even worse. So it's going to be nuts.
Mate, we've just been given a job over from the police regarding a gentleman who was in a paddock across the road, is he? Or
He's actually on my property. If you're hearing a bull, that's him.
is he making sounds of a bull, is he?
Yep.
Okay.
So it begins.
Blood moon! Can I find out what the blood moon actually means?
It's a solar eclipse, and the next time it happens is in like 35 years or something like that.
Having returned from their latest call-out, Gina and Biffy are on standby in the Darlinghurst nightclub district.
So, tonight, blood moon.
Something about the sun creating a shadow off Mars, which creates a bloody moon.
Wait, when's the next
Create.
time it's going to happen? I feel like that's why it's significant, because it's not going to happen again for a while.
Well, 100 years.
It's going to happen again in 100 years?
Yeah. 5:30 is the total eclipse.
You're going to sing that song?
That is
Total
early.
eclipse of the sun.
Of the heart.
Oh. Of the heart.
Ambulance emergency. What town or suburb?
Darlinghurst, on the corner of Oxford and Crown. I was just had a gentleman walk past. He looked like he was taking too much THC.
So are you with him right now?
Yeah. Not really responsive.
Approaching midnight, an alarming trend starts to emerge around the pubs and clubs on Oxford Street.
You think she's taken something? What kind of stuff's coming out of her nose and mouth?
There's a massive spike in drug overdoses, most involving the party drug G.
So we understand he's taken G, is that correct? All right, as I mentioned, I'm organising help for you now.
43, I'll get you to 1 Charlie 17 in Darlinghurst, please.
Copy that, drop it down.
Yeah, it's going to be up by Oxford Street, I reckon.
423, fortunately they're nice and close for it. It's one of the many overdoses, drug affected, that we have running at the moment.
Is she having an overdose?
Oh, she's asleep at the moment, they said, but they're not sure if she's okay or not.
Right now, there's a new overdose call coming through every 8 minutes.
Another one. There's a lot of calls for it.
Oh, man. All right, I'm going to need guys.
Ambulance emergency, what town or suburb?
Darlinghurst. We checked for drug overdose out the front of our venue.
Friday night in central Sydney, and there's been a spike in overdoses, particularly with the party drug G.
Sydney to Inspector 21.
Yeah, I've got a Nelly code 17 for you, this time at Darlinghurst.
G, or GHB, is a depressant drug that's been on the rise since 2016. Its effects are unpredictable as communication between the brain and the body is compromised. Overdoses can be fatal.
There's 3 all in Oxford Street.
Yeah, right.
All within like a couple of blocks from each other.
Oh, I wonder. That's interesting. Someone's maybe sold some dodgy stuff in the same area.
It does happen from time to time where it's clearly obvious where a dealer has been, either outside or inside that premises, giving it to a few people who probably haven't done it before or are addicted to the substance.
Have you been to many?
Not too many G.
Paramedics Biffy and Gina are responding to reports of an unconscious man phoned in by concerned passers-by.
I find G a very bizarre drug.
Quite the party drug of choice. I hear that they come in those little soy sauce fish capsules.
Yes. It's like a...
G, up or downer, up or downer.
GHB has a unique effect where it has waves. So the patient can be unconscious for several minutes and then wake up and be ready to go and party, and then a couple minutes later can be unconscious again. So that is very unique.
Just here.
Yeah, he's just there on the floor. So usually if someone completely overdoses with G and is unconscious, then they are still breathing for themselves.
You guys just found him like this?
But because they're still breathing, they can vomit, they can choke on their vomit. They might be laying in a dangerous position, whether it be on the road or by themselves in a corridor, and other issues can happen with them.
Hello?
If you have too much G, it is like any polypharmacy overdose. You can die from it.
Hello? Hello, darling. Hi. It's all good.
Right.
Your hat's behind you. I think your friend's got your hat there. Can we just check out your heart really quickly in the ambulance? Hello. How you going? You all right? Yeah? Oh, good, good.
Just watch where you're going. There's something in front of you, okay? Let's just take you somewhere where it's a bit more quiet, okay?
Oh, darling, just take a seat there for me. Thanks so much. Last thing you expected to have someone in your face waking you up like that.
Had a million coppers around you.
Beg your pardon?
You had a million coppers around you.
I did.
Yeah.
Sorry.
That's all right.
No,
Don't
you're
worry.
fine. That's good. Blood pressure's good. So no medical conditions? No. Don't take any medicine for any reason? On the nod. So what we're going to do is we're going to take you up to hospital, okay? I know you're up and about and up and at it at the moment, but you're a bit confused. Hence, we can't really
leave you.
Yeah, leave you here because you've got no one to sort of take you home and all of that. So let's go up to hospital. You can sleep it off there. All right? Okay.
I have nothing against those people that do go out and party. My opinion on recreational drugs has changed because when you start working on the ambulance, you often see a whole lot of other side effects or injuries caused as a result of drugs, whether that be getting hit by a car or getting assaulted or going in a fight yourself. We see a whole range of things that are related to recreational drugs.
Is he out? Yeah. He's quite calm and just needs a bed for the night.
Sometimes I get a bit frustrated because I would think I would never put myself into that position where I'd have to call an ambulance or let any of my friends do that to themselves. So I guess it is a job well done. At the same time, it is frustrating because they have done it to themselves. But we've saved their life.
Is the moon out yet? No, but is it like changing colour yet?
Saturday, 2 a.m. in the Sydney Control Centre. As the busy night wears on, call takers are convinced there's something else going on.
Pardon? 3 cans? How did you accidentally inhale 3 cans of spray?
Blood moon.
Do you require an ambulance there?
No.
Does anybody there require an ambulance there?
No.
Hello? You've got the ambulance on the line. Come to the phone, please. Hello?
On a full moon, look how strange things happen.
Tell me exactly what happened.
My son's been fishing last night and he's got something under his skin that's crawling up his legs.
My friend's different. I cooked blitz with my crab. He was intoxicated, he got scared too, and he did it. My wife is collapsed on the ground and I can't pick her up. So she's about 20 stone.
It's a 55-year-old female who's 127 kilograms, has collapsed and can't get up.
That's very precise, 127. Did she fall onto a scale?
Already tonight, there have been 45 call-outs to people who've fallen and can't get up. It's a very common job for paramedics, but each case is different.
There's hubby. Hello. Good, how are you?
The rocket's on the ground inside.
Okay.
You might have to reverse it or you can put it on the footpath.
I'll just leave it here, mate.
Yeah, sure. Right.
Alrighty.
Okay.
That grass is squidgy.
Oh.
Where are you going? You definitely never know what you're walking into. Sometimes the notes that come down on our computers are very vague, and other times they're very descriptive. So we could be walking into situations that we're definitely not prepared for at that certain point in time. Ooh, that goes up.
Whoa.
Yep. Alrighty. Where is she? Hello. How are you?
She's a diabetic.
Okay. Do you fall over a lot? Not really. How did you fall?
The thing is too is her feet are swollen up. And she probably tripped over, lost her balance that way.
Just her own feet?
Yes.
All right, I'll go in front, Josh. You happy at the back?
Where's your bedroom, my darling? Down
That's their bed.
You sleep on this lounge?
Sleeps.
Jolly good. Let me just clean your bed up so
Do
we
you
have
want
a
to
place
give me
to
a
place
little
you.
bit of room, sweetheart?
Yes,
Beautiful. All right, Ingrid, do you reckon you can roll on your back for me, my love? Yeah? Alrighty.
I think Brian's just having a panic attack.
Who's Brian?
That's me.
Why is he having a
What do
panic
you mean? You
attack?
can't get you up, my love.
Well, did you want to sleep on the floor tonight? Was this your choice?
No.
No?
No.
You're okay.
We're having a moment here with some washing. Hang on.
Uh-oh.
Uh-oh.
Sophie's wrecked the Great Wall of China and it's about to come down.
It is, eh?
We need to move quick.
You
We
set
need
me
to move
going.
quick, otherwise you may be trapped
Patient code 9.
under laundry.
Okay.
All right, darling.
1, 2, 3.
Wow.
You are a very tall lady.
You're taller than I thought.
Hello.
This is so embarrassing.
No, it's not. I end up on the floor all the time.
How about we have a seat on the lounge and I'm going to check a few things. Yeah?
Any pets in here?
No.
No pets.
No pets at
That
all.
we know of.
No.
No?
No pets.
You can go days without doing an actual intervention on a patient, whether it be a cannula or administering oxygen or anything like that. You're a social worker for the community a lot of the time, dealing with people's problems that they just can't deal with them themselves.
So you got a little bit of a temperature, my love.
Hello?
You do. Do you feel more drowsy than normal?
A little bit.
Or are you just drowsy because it's 2 in the morning?
Is it?
Yeah.
You have 3 more hours and you get to see the blood moon. So don't give up, you've come this far.
All right.
You know, it's all good to, know anatomy and physiology and all the drugs and all the real cool stuff. But it comes down to a good paramedic is just someone who has a broad life experience and knows a little about a lot.
I can't believe this. Oh, Bronny had a panic attack.
He rings the ambulance.
I can't lift you up, the size of you.
Oi.
You're going to get in trouble.
Yeah, that's a death sentence, mate.
Are you happy to sign on her behalf saying we've come out, we've popped her back on the lounge and you guys are happy?
Yeah.
Alrighty. All the best, guys.
Thank you. You're all right, mate.
Ambulance emergency. Tell me exactly what happened.
My tenant downstairs has come down with what looks like his neck slice and holding the blood gushing out.
Get a clean, dry cloth or towel and place it right on the wound and do not lift it up to look, okay?
Today's just been crazy.
Does she have a weapon? If you're not safe, you need to get out and call us from a different location.
The pace of calls, the type of calls, a lot of people just very argumentative.
Listen, I've organised help for you. It's so we can make sure that we're coming to the right place. That's why we're asking. I didn't speak to you before, so I need to make sure that the information is correct, okay?
It's like as the day just gets on, everyone's just getting a little more anxious and a little bit more worked up.
Keep going, no breaths yet. Compression still. 1, 2, 3, 4. 1, 2. All right, stop, sir. Stop the compressions. Stop. All right, you need to tell everybody in the room to go away because they're not listening.
Ambulance emergency, what town or suburb?
Hello, someone got hit by a car this afternoon. We might have severe head trauma. It's an emergency. They're literally in the middle of the road. They're passed out on the ground. They haven't moved.
Looks like we're at a job.
Duty Operations Manager Brian is in one of 3 vehicles immediately dispatched to the injured bike rider.
Seriously, people.
A transport ambulance is coming from Northmead, while Inspector 38 is first to arrive and reports in.
Inspector 38, go ahead.
Probably that. They've just confirmed 1 male was struck by a car, combative head injury. Combative head injury, care flight is required.
City Inspector 34 and all other cars.
Care flight 3 has been told to my head.
Inspector 34 received.
Copy, thanks. All right, care flight's on the way.
We've got 2 transport cars, an Inspector 34 and a yellow.
The cyclist collided head-on with a car at 40 kilometres an hour, and his head injuries are critical. The specialist ambulance helicopter medical team is scrambling from nearby Westmead Hospital. And another intensive care paramedic team is also dispatched.
There's the helicopter. Not many spots to land here, dudes. Here we go. All right, so what we'll do, lay him down and then we'll get him on the bed, okay?
Brian is a senior officer and takes control of the scene. Despite his severe head injury, the cyclist is conscious and agitated.
We need to manage that airway properly too. Head back, head back, head back. Yeah. Sit down, buddy. It's okay, mate.
Put your head back, mate. Put your head down.
If he continues to struggle, the risk of brain damage and death is high.
All right, buddy. Just relax, mate. Just relax. All right, buddy. Come on, just relax, mate. Sit down, buddy. It's okay, mate.
Put your head back, mate. Put your head down. It's okay. It's all right. I'm not going to
It's all right, buddy.
In Sydney's West, Duty Operations Manager Brian is leading a team working to save a cyclist's life.
Just relax, mate. Just relax.
He has a fractured skull and possible brain damage, a leading reason patients die before reaching hospital.
I'll just get the ketamine organised and I see. His drop's okay. He's quite agitated. He's got a head injury. He's GCS 13 at the moment, but he's non-compliant. So what we'll do, we'll give him some ketamine IM. The medical team will only be a few minutes off, and then the plan will be, once we get him under control, we'll lay him down and then we'll get him on the bed, okay? Now, he'll probably get a tube for his trouble, so we'll probably intubate him here. All right, let's give some K.
Mate, just hold nice and still. Sharp out.
Every second counts. This type of injury can interfere with the patient's breathing. Carbon dioxide builds up, leading to secondary brain injury or death.
All right, prepare to lift? Lift. Okay.
They're waiting for the helicopter medical team to put him into an induced coma, so a tube can be inserted down his airway as quickly as possible. But the chopper is still trying to safely land in a nearby park.
What's the ETA of the medical team?
The quicker that we can place that patient in induced coma, the better their outcome. The longer we wait, the longer that patient is exposed to that sort of potential for a secondary brain injury, the chances are the difference between walking out of hospital and potentially ending up in a brain injury unit, or even worse, dying.
Go ahead.
This is the pilot, the paramedic and medical crew has departed to the patient.
Graham, you can probably do with a tube, mate.
The helicopter medical team finally arrives.
So his injuries are all head. He's certainly got a depressed skull fracture there. He's got a boggy mass posteriorly, and he's got blood pissing out the ear.
I think you're right. It looks like he's going to be an easy tube, but I think we should just get on with it.
Yep, righto.
With the addition of the medical team, there are now 10 paramedics working together to save this patient's life.
Okay, so we need some cannulation equipment on this left side, and I need a line in, please.
Yep. There we go.
We'll need 2 lines, preferably, because we're going to RSI him, so we want to have 2 lines in.
Whilst it may appear chaotic, it actually is very controlled. And you'll find that the more serious the patient, the less talking that gets done, because everyone knows their role.
Where's your kit, Craig? Can you hold that bag of fluid up for him, please?
That's the joy of being a paramedic. It's, you know your job, you know what needs to happen, and more importantly, you're there and you're a team player, and everyone is focused on one thing, and that's the care of the patient.
So if that line is in. Okay, I'm going to give him 250 thio and we'll get on with it. Okay.
To run a tube down the patient's airway, the medical team must first administer drugs to anaesthetise him and paralyse his muscles to stop him moving.
He's a bit more manageable now, Al. Okay, we ready?
The timing needs to be perfect. Once paralysed, the patient can't breathe for himself. and needs to be intubated within the next minute.
Hold it there, I've got a pogo of 100%. Beautiful. Okay, I'm through the cords.
So it's a good 98%.
Tube over. Tube coming. Okay, tube. Okay, we're coming through. And that's you're way down, so yeah, let's go on.
The tube is in place and the patient's airways secure. Paramedics will breathe for him on the way to hospital.
Okay, we clear. We're going to get out of the way. We can load them.
I take a lot of pride in my colleagues and the way they do their job. I think every day they come to work to do their best. You know, to be working in such a highly focused team, to be working as part of that team is very rewarding. And that level of commitment that they come to work every day to provide the best care they can for patients, like, you cannot get that. If you could bottle that, you could sell it for millions.
Low back sore. This chair ain't doing it for me.
I've had my lumbar support, the extra one, for about a year, and tell you what, I cannot sit in a car without it anymore.
I'm surprised you don't get one of those wooden bead things. Remember the taxi drivers used to have? I haven't seen them in years. Remember those seat covers?
Can we get them and kit this ambulance out?
Do you remember them?
Yeah, they're still around in the cabs.
We should get them. We should deck this thing out like a full taxi cab.
As long as we can have fluffy dust hanging from the rearview mirror, I'll be happy.
Hello?
Hello, is this Kim?
Hello?
Hello, this is the ambulance service here. We just received a phone call from the alarm company about Maria.
Yes.
Is she having a seizure at the moment?
Yes, please.
The control centre has received an alarm activation alert from a recurring patient. The young woman is having a seizure, which she's suffered numerous times in the past. Paramedics have often been called for help at this particular home, but it's Josh and Sophie's first time.
Alrighty. What happened tonight?
She just got started seizures, you know.
Does she normally have seizures?
Yes.
She does. What's her name?
Maria. Yes.
So, how long did the seizure go for?
I think a couple of minutes.
A couple of minutes. And is that normal for her? Is that a couple of minutes long?
Yes.
Hello?
She's deaf.
Is she profoundly deaf?
100% deaf for a long time.
She can't hear anything.
Does she have hearing aids? No. What about cochlear implant?
He got a cochlear implant in there, but can't have.
Oh, it doesn't work?
Doesn't work for a long time.
Ah, bloody hell. Does she sign?
Yeah, they live in sign language.
She knows sign language?
A little bit, and lip reading too.
What condition does she suffer from?
She got an NF2 disease.
Yeah.
So it's just like have tumors everywhere over her body.
So they eat on the ear, the nerve, so she can't hear anything, you know?
Okay.
Yeah.
All right.
Maria has a rare genetic disorder called neurofibromatosis, or NF2. From the age of 18, tumours have grown in the nerves between her ears and brain, affecting her balance, and she's completely deaf.
How often will she have a seizure? Once a week, once a month?
Maybe sometimes 6 months or something like this.
Okay, so not very often.
The NF2 is causing Maria's seizures. The tumours have spread and are pressing on other parts of her brain.
Honestly, yeah, she's very, she's in incontinence pad. She's very unwell, eh?
Yeah.
You okay? You okay?
No.
Bad? Pain? Bad? Good. Yeah.
Seriously?
Yeah, my brother's profoundly deaf.
Oh, really?
Well, half my family's deaf. It's genetic in my family. Sometimes in this job, we can see people who've been dealt a poor card in life. Young kids, you know, it affects us the most, I'd say, because These kids have a whole life ahead of them and it's just going to be an uphill struggle. Look at all these paper origami.
They're cool.
And I think that's sometimes very sad to see, especially as a parent.
Your jacket. We can get you a jacket.
You admire the parents and carers for these people that are dealt poor cards in life because they don't want our sympathy. They just might need a hand and they just get on with life, which I think a lot of people could take a leaf out of their book. You come in the ambulance?
You want me on the front with you?
No, I want you to drive. No, you sit in the back with your daughter, is that okay?
In her bedroom, there's jars of the birds. She makes them. Has she done all the jars? Yeah. They're beautiful. She's got 4 jars so far.
Yeah, she makes a lot of...
Yeah, she's getting there. When she was little, could she do things for herself?
Oh, she go to the school very well until year 12.
Yeah.
They found out she got a big tumor in between the ear inside there.
Okay.
And then 1 month later, they operation, and after that, all the time hospital.
Never the same since then. The surgery she had a month ago, was that to take a tumour out? Yeah.
A lot of tumor growing up along the spinal cord and the head all the time.
Really?
Yes.
How many surgeries do you think she's had?
More than 10 times already.
More than 10. And she's 30-something, isn't she? 35?
34 now.
30, yeah, almost 35.
Come out this way, mate. You're welcome. For me, it helps me sleep easy at night to know that I did all I could for this person at that time. Because this person lives this, I've only got to see a glimpse of it for 20 minutes, half an hour as a paramedic.
All right, do you want to follow us in?
They battle and their life is hard. They haven't given up. And that's what's grounding about being a paramedic. It is sobering. Brings you back down to earth.
Yeah, we don't have a million tumours in our body.
Like, that is one of the shittest things about being a parent, is that as if that was your kid, for that to happen. If that was you, you'd be like, yeah, that's shit, but...
Did you hear the story? Apparently she was absolutely fine up until year 12.
Yeah.
And then they found like a ginormous tumour apparently between her ears. Straight smack bang in the middle.
That's why I was looking at that school photo and it was just...
Normal.
Didn't even look like her.
No. I will do job after job after job of those any day of the week. Those are the people who are not abusing the system. They've been dealt the shittiest hands of cards possible and they're dealing with it.
That's it. They didn't ask for that.
No. They did not ask for that.
It's a cruel world.
Sydney, very good morning to all crews standing by for the 5:45 sign on this beautiful Saturday morning with the blood moon going on at the moment. If I could please get Marrickville Station up for sign on, thank you.
Ambulance, what's the town or suburb of the emergency? Caller, can you hear me?
Yes.
What's the suburb of the emergency?
Head.
Pardon?
My grandfather has hit his head.
All right, we'll get some help out for him there. What was your name?
Tiana.
Okay. And you said your granddad's hit his head. How did that happen?
He won't tell me because he's a little bit dizzy and he's lost his speech.
Okay. And when you say he's lost his speech, what does he sound like?
He says he wants to talk, but he can't.
He can't? Okay. And did you see what happened?
No, I was getting ready for school.
Getting ready. Okay. We'll get some help out there.
Clear left.
Okay. I need you to ask him to smile.
Okay. Can you smile?
Was the smile equal on both sides of his mouth?
No. No, okay.
Now ask him to raise both arms above his head.
Yeah.
And what was he able to do?
Not fully straight.
Not straight? Okay.
Juggling. Alright, now we've got help on the way.
No, not enough room. Unless you want to get on the garter.
And has your granddad ever had a stroke before?
I'm not sure.
Clear left so far.
Now, I just want you to reassure your granddad that help is being arranged. So I want you to watch him very closely until they get there.
Might be a bit of a chaotic scene initially. It doesn't mention that there's the parents of the children on scene, so...
Oh, damn.
Big smack.
We need to stop.
Yeah, we do. Do you want me to do it?
Yeah.
451.
451, go ahead.
We've just witnessed a 3-vehicle significant nose to tail. We're going to have to stop here and attend this scene.
Roger that.
Well, that's that case. Find another for your current case. Stand by while that handover happens.
Ramping up.
501334, you're responding as primary and only to a case of 79-year-old male conscious and breathing with slurred speech. This case was originally attached to a different car, however, they've had a field initiated. Code 1, thank you. 501334, noted, thank you.
Every day, Queensland Ambulance receives more than 3,500 calls for help.
I had a bloke on a ladder and he fell down and he's on the ground unconscious.
I've got a 67-year-old who's got chest pain.
It looks like she's going into shock.
Well, we're getting help there for her right now. What's your name?
For the first time, our cameras go to Brisbane, behind the scenes of Australia's busiest paramedic service.
That E-team is ready to roll.
We're going to get him cut out.
It's all right. My partner's going to bring the ambulance around.
3, all critical.
With exclusive access, we follow emergencies from the operations centre.
My son stopped breathing.
And I've shot myself with a nail gun.
My water's broke.
You know how far the javelin's gone into his groin?
To the life and death decisions of the paramedics on the road.
TD code 1, CPR in progress.
Get in the car. What have you got there?
Good news is we know what's going on, mate. The bad news is it looks like you're having a heart attack.
Behind the lights and sirens.
Oh, wow.
You're in the best hands you can be in, OK?
These are the true stories.
You're cheeky.
And how's your pain at the moment, darling?
Of Queensland Ambulance.
Just a few questions, all right, and I'm going to get some help for you.
Knock, knock, ambulance.
You definitely did the right thing by calling.
You did so well.
Brings a tear to my eye.
Even just to hold someone's hand, I love to feel like I've made a difference in someone's life.
It's the start of the morning shift at the Brisbane Operations Centre.
Good morning, 501108, reading in 5 from 5. I'll send a test page through now. Have a good day.
555 also, test page received. Have a nice day.
Where more than 250 call takers and paramedics are on duty.
Right. You missed a bit. You missed a bit. There and there and there.
On any given day, the Operations Centre can expect to dispatch ambulance crews to more than 1,200 incidents.
His hands are it's Russian roulette as to what you're going to get. And that's with any call. It really is luck of the draw. You don't know what's happening.
Mid-call, he cuts off his ear, and I'm like trying to
Cuts off his ear?
Yeah, I hear it. I'm like, well, who's that man screaming? And she's like, he's cutting off his ear.
And I'm like, can you find the parts, put them in a plastic bag?
With what?
Scissors.
Okay, tell me exactly what happened.
Looks like he's gone down through the fabric and hit a bus.
A car's hit a bus?
No, motorbike.
Motorbike.
Someone's riding the BMX track and they stacked the jump and they hit their face really hard and he's like having, I don't know, he's sketching out.
My partner's having problems breathing. He's on the floor. He's 55.
A 000 call has come in from Woodridge.
Is he changing colour?
He's a bit white, grey.
And is he claiming you're having cold sweats?
Yeah, he's having cold sweats.
A man has collapsed on the ground with a suspected heart attack.
Does he have difficulty speaking between breaths?
Yes.
2 emergency vehicles are dispatched. Ambulance 1478 is the nearest available crew, 4 minutes away. Critical care paramedic Sophie is also dispatched. She is 6 minutes away.
When I applied to become a CCP, I was coming into it as a bit of a minority, being like a young female in maybe an older male population in the role. But I mean, it's becoming more diverse and there's a lot more females in the roles, so it's exciting to be part of that change. The best bit about the job is being able to help someone in the worst day of their life.
CCP Sophie has a higher level of medical training, allowing her to take the lead in more extreme situations.
Level 3-7, the crew have advised they're now to complete heart block, some small episodes of conscious VT, and it's now reverted back to heart block.
Roger, I'm not long away.
Heart block is where the heart beats too slowly, while VT is caused by improper electrical activity in the heart. The patient is suffering both, each of which is life-threatening.
Hello, hey guys.
Okay, so this lovely gentleman, 55 years old, had some pain yesterday, which self-resolved. It's happening about 1 o'clock. He's had an onset again of the pain. 1 o'clock this afternoon, central chest
Significantly
heaviness,
reduced.
with right arm radiation significantly increased. Yeah. So I need to ask you a heap of questions, okay, mate? If you are having a heart attack, we want to give you a few more medications, all right? Okay.
Hey, how you going? Can we start with just a stretcher at the bottom and a stair chair? Thank you.
All right. You're not on any current anticoagulants? No blood thinners? No? All right. No active bleeding at the moment. I know I did ask you before, you haven't had any blood in your poos, wheeze, nothing? Have you heard of something called haemophilia?
We'll just get a V4R.
You haven't ever been
Just
told
a
you've had
V4R.
any issues with clotting disorders? No. So no issues with...
a blanket, please.
Mate, we're going to do the best we can, but we're actually going to take you down a staircase soon and we won't be able to have a blanket on you, okay? Yeah. Well, so let's sort the heart out and we'll get you warm as soon as we can. Yeah, can you crack a heating blanket down the bottom? Heating blanket down the bottom. So I've got a...
Going good.
Is it gone? It was a 7 when we got here. Have you got pain still?
No.
No, okay.
No pain.
Could be wrong about heart attack.
Look, this is what we're trained in sort of identifying. So you have a little blood clot in one of the vessels in your heart that's occluding blood flow. And
How do you know that now?
Based off the ECG changes that we're seeing, we're pretty highly trained in this sort of thing. The good thing is your heart rate's picked up a little bit more and your blood pressure's looking really good.
All right, we're going to get you up. We're going to help you onto this chair. Once we get you on the bed, we've got a blanket heating up ready for you, okay, to try and get you a bit warmer.
And sorry, your name, sorry? Kevin. Okay, we'll start extricating. When we're doing this, can we have one person looking at the monitor at all times, all right? The major risk here is that his heart attack will turn into a cardiac arrest. The outcomes can vary. The outcomes can be really great and that person might walk home with no troubles versus that patient might not survive at all.
The patient appears to be stabilising, but the blood clot means he's still at high risk of slipping into ventricular fibrillation, or VF.
Let's crack on. All right, sweet.
If he goes into VF, his heart will stop pumping blood, and he will go into cardiac arrest.
Just relax down there, Kevin. You're doing really well, mate. It appears you're suffering from a heart attack. Okay. Yeah, mate, you got to listen to those feelings, hey? Yes.
We've heard that one before. This one is another one of those blood thinners to help with that clot, okay?
So mostly with these medications, we're trying to sort of hold fast and make sure that the clot doesn't get bigger and bigger and bigger. Because obviously if it completely blocks off that coronary artery, then there's sections of your heart just not getting enough oxygen and blood. All right? Thanks, mate. Oh, too hot? Okay. All right.
Getting dizzy.
Oh, yep, let's lay down a little bit. Yes, you are getting dizzy. Okay, guys, he's in VF. So I'm just charging. Pads, are they connected?
Pads are on, yep.
All right, guys, we're going to do stack, shock, 3 stacks. Is everyone clear? Shock, charging. And we've got sinus, I think, but we'll just charge and stop at the thing. All clear, hands off, let's check. I think we still have a VF. Yep. Is he awake?
Yep.
What the happened?
He's still in VF.
Rest, mate. Just rest your head back for me. Rest your head back.
He's still in VF. Is his eyes going back?
Yeah. Rest your head back for me, mate.
Can you feel pulse?
I'm gonna cardiovert him.
No, no pulse. All clear?
All clear.
Charging?
Sorry, mate.
No, he's... All clear?
You're right, clear.
All clear. Okay, all clear.
Yeah.
3 shocks. We're going to do stack, shock, 3 stacks. Is everyone clear?
Yeah.
Shock, charging. I think we still have a VF.
Yeah.
Yep. Is he awake?
Yep.
What the happened?
He's still in VF.
Mate, just rest your head back for me. Rest your head back.
He's still in VF. Is his eyes going back?
Rest your head back for me, mate.
The patient's heart has stopped. He is now in cardiac arrest.
No, no pulse. All clear?
All clear.
Charging?
Sorry, mate.
The blood clot has deprived his heart of oxygen, but somehow Kevin is still conscious.
All clear?
You're right, clear.
Okay, all clear.
Clear.
3 shocks. In all my years of being a paramedic, I've never witnessed someone to be in ventricular fibrillation and still have a certain level of consciousness. Phoebes, I'll get you to jump out the back here.
Happy for me to start CPR?
Yep, start CPR. I'm going to make a phone call for intra-arrest lysis. I want you to bag. So we've just got a bit of consciousness with this VT. So last shock was 30 seconds. We're going to analyse at 2.
You're okay. You're okay.
It's not going to have too much effect on him with cardiac arrest. Okay, it looks like we've still got a VF, guys. I want you to draw up some adrenaline after that. You're analysing at 2 minutes and shocking if required. I'm making a phone call for intra-arrest lysis. Are we all on the same page?
Yes.
The whole plan has now changed. My concern now is breaking this clot up.
You're doing really well,
Sorry,
Kevin.
honey, your heart's still
Okay, guys, I'm charging.
Yeah, keep doing what you're doing, mate, all right?
Sorry, Kevin.
Hey, Jay, Sophie from Logan Paul. Can I get through to the doctor straight away, thanks? Guys, all clear, hands off.
Everyone clear.
Everyone clear. I see VF and shocking.
Sorry, buddy.
Hi, Sophie, it's Steve.
Hi, Steve. Hi, mate.
Sorry.
Okay, sorry. We've got a patient here, confirmed STEMI, accepted for PCI. He's a 54-year-old male. We've given heparin ticagrelor. He's had a VF arrest. Currently had 3 stack shocks, 2 minutes of CPR with consciousness. He's now had another shock, still in VF. Calling to consult for intra-arrest lysis.
Sophie needs approval from QAS Medical Director Dr. Stephen Rashford to use a high-risk clot-busting drug.
Yeah, no, how long has he been in arrest for, Sophie?
He's still only 4 minutes, but he's still refractory VF.
Okay, no, how much does he weigh?
75 kilos.
Okay, so why don't we give him 40 milligrams of connector play
and just do another cycle while you're drawing that up and shock it. If it's still in VF at that point, give him the connector plays 40 milligrams.
Okay, I have the medication we're using to thrombolyse, called tenecteplase, is a pretty high-risk medication. Obviously, it causes bleeding because our intention is to break up a clot.
Everyone clear. Clear.
Still VF.
However, looking at the patient's current situation, okay, Jess, their heart's not beating, they're not breathing. The risk is that, yes, it might cause some sort of serious bleeding. You're doing good, guys, but the risk of not giving it is this patient's going to die.
All right, adrenaline's in.
And just don't push the amiodarone until we see if this works.
Yeah, that's in.
Okay, team, I'm going to charge. All right, guys, hands off. Everyone.
Dan, hands off. Front.
All clear?
Clear.
Okay.
Can we get it straight back?
Oh, sorry to turn off.
Sorry, Kevin.
Okay.
Okay, tenecteplase is going in.
Our priority is to save this patient's life. So our priority is to administer what we need to administer, do what we need to do to save his life. Jess, can you take over CPR?
Yeah.
All right, we're charging now, so let's do it on the charge. This is something that is not a routine thing at all. It's quite risky. But at the same time, so is cardiac arrest, so is death.
Kevin's heart is not pumping on its own.
Ready, Ben? Yep, go.
Okay.
The paramedics are the only reason he's still alive.
Yeah.
The clot-busting drug now in his system.
All right, and I'm going to be charging.
They have to keep their CPR going to give the drug a chance to work.
Okay, all clear?
All clear.
I still see VF. You see VF?
Yeah.
Shock. Okay, let's push adrenaline. And can we push that amiodarone first?
Yeah.
Here we go.
It's in your pocket. Yeah. Thanks.
Yeah.
If the clot is cleared enough, each time they defibrillate,
Okay, we're charging.
there's a chance Kevin's heart may reset successfully and start beating on its own.
Okay, everyone clear.
Clear.
Confirming VF. Yeah. Shocking. Cool. That's 9 shocks, so. All right, we're charging. Keep going, Steve. Keep going. Okay, everyone clear. Confirming VF.
Yep.
10 shocks, and still Kevin's heart hasn't restarted. He has no pulse.
Guys, we're probably going to start heading to hospital, okay?
Yeah.
CCP Sophie and her team are forcing the clot-busting drug tenecteplase through his body by CPR.
Okay, I'm coming in.
They're hoping it will break up the clot before it's too late.
We're going to have to be doing CPR on our way now.
The longer Kevin's heart isn't beating on its own,
Charge.
the higher the chance of his heart dying.
Okay. All right, everyone clear.
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 We're still in VF.
Yep, VF. Shock.
Ding.
I probably never thought about death before being in this job at all. And I've been in this job since I was like 20 years of age. Okay, I'll take over CPR and you can do some ventilations.
Just start moving. I'll get everything ready.
Just gentle, Phoebe. It's quite a traumatic experience. Like, you're doing CPR, you're really, ribs break, the patient can have blood start to come out of their airway. It's a traumatic experience trying to resuscitate, trying to manually pump someone else's heart. Okay, guys, all clear?
All clear.
Clear.
Confirming VF.
Yep. When you're in the middle of doing a resuscitation, you are just thinking so clinically. You've got an outcome you're trying to achieve. And although there is some emotion about, this person is in cardiac arrest. Okay, back down, let's analyse. You want to try save their lives. Yeah, shock it. All right, keep going. Nice, firm CPR. Let's try to push that tenecteplase around. I've got a whole team that I'm guiding. You can't just be emotional yourself because your job is to be their pillar so that you can be strong for them. the outcomes can vary. The outcomes can be really great, and that person might walk home versus that patient might not survive at all. So our priority is to do what we need to do to save his life. All right, guys. Still no pulse, still VF. He's had 13 shocks and CPR. We've got metronome core patch. He's had 3 adrenalines, 450 of amiodarone. He's had 40 of tenecteplase, 6,000 of heparin, 180 ticagrelor, 300 of aspirin, and 50 of fen. Is that correct?
And 8 of Ondans.
And 8 of Ondans. Okay. I really hope that we can get this patient to hospital in a state that he can get the cardiac care that he needs. Okay, Jess, once you've done that, I need you to give half a ml of this. We don't just want patients to survive. We want patients to survive back to normal outcome. We'll lower the stretcher down and everything, so we're good now.
You good still?
Yes.
This is down, I'll take it.
Okay, lower the stretcher. Okay, guys, wait, let's connect to the O2. I got the bag.
Okay, O2 is connected.
Okay, guys, let's stop. We need to stop. We're going to charge. Phoebe, charge. Okay, guys, stop. Rhythmals. I've got a pulse. It's a rate of 20. Cancel shot. Continue CPR.
Okay, stop. Yes.
Rate of 20. I can feel a weak carotid pulse. He's alive. This case was one that I'll remember throughout my career. It was an extremely long resuscitation with a very, very sick patient with a reversible cause that we had to work really, really hard to try to fix and really hope that he survives. And not only that, but is able to go home to his family and live his life like he did before this event today.
All right, my pleasure. Bye for now.
Tell me exactly what's happened.
There's a rodeo happening here, and a man's just been sort of hit in the face by a bull.
My daughter, she put one piece of in her nose.
My son has a cyst between his face, and he's just in absolute pure agony.
Ambulance, what's the town or suburb of the emergency?
My daughter's in labour, and she wants to push now.
Okay, now are you with her now?
Her partner is, yes.
All right, are you with her though?
Yes, well, she's in the house.
Right.
Yes.
You need to get closer to her. How many weeks or months pregnant is she?
She's due a couple of weeks. The baby's coming. Quickly.
Okay, can you see? I need you to listen. Can you see any part of the baby now?
I don't know. Can you get somebody out now?
Okay, they're coming as fast as they can. Can you see any part of the baby now?
Yes, come on. It's blood. It's all bleeding. It's all coming out.
Oh, shit.
It's all bleeding. It's all coming out.
Okay, the head's coming out, is it?
It might be.
Okay, now I'm organising help for you now. You need to stay on the line. Now I need you to listen carefully. Put me on speaker.
Sorry, I can't put you on speaker. I don't know how to do that.
Okay. Now, with each contraction or labour pain, place the palm of your hand against her vagina.
Okay, place your hand against her vagina.
Okay.
Contraction.
Okay, it'll prevent from tearing her. Now, say exactly what I say to him now. As the baby delivers...
As the baby delivers...
Support the baby's head and shoulders.
Support the baby head and shoulders.
And hold its hips and legs firmly.
And hold her hips and legs.
Hold its hips and legs firmly. And remember... Remember the baby will be slippery, so don't drop it.
It will be slippery, so don't let it go.
Listen to me. Have her push hard to get the baby out.
Push hard to get the baby out.
All right. Now have her push hard to get the baby out, okay? I can hear her straining in the background. Yvonne, go and hold her hand, okay? And help her push.
Push. Come on, push, Sharon.
How much of the baby is out at the moment?
Half his head. He's stuck.
Okay.
Push, Stephanie.
Tell the mother to lie flat, grab her knees and pull them to her chest.
We're grabbing.
Okay, that's it. You're doing a great job. And tell her to push hard to get the baby out.
Push. The head is just sort of stuck, so push.
Another big push. Her knees need to come up further. She needs to push harder.
Push, get your knees up to your chest harder.
That's it.
Keep pushing.
You're doing a great job. Encourage her to push hard, okay?
Okay, try pushing harder. Oh, shit.
Hold on to the baby.
It's coming out. That's right.
They're very slippery. Do not drop the baby. Hold the baby firmly, okay? Is the baby completely out now?
He's out.
He's out? All right, congratulations. Now, is the baby crying or breathing?
Yes.
Okay, that's great.
Do you know how far away the ambulance is?
They're coming to lights and sirens. I'll be right with you until they get there, okay? Now, do not cut the cord, okay?
No, we're going to leave the cord there for the ambulance guy.
Now, the afterbirth should start to deliver soon. Can you see any of the placenta?
No, can't see because of where he's lying and we've got the towel over here.
No, that's okay.
His eyes are open.
His eyes are open? Oh, that's great. That's great. You got a name for him yet?
Yes, Roman.
Roman, is it?
Yeah.
That's such a great name. And how's Mum doing at the moment? Is she excited or a little bit?
She's doing pretty good.
She's doing really well. And was this her first delivery?
No, second.
Her second.
I've got a 4-year-old son and he's asleep.
Oh, so this is going to be a big surprise when he wakes up. Okay. You did a fantastic job for a very stressful situation. How's Dad after all of that?
Oh, he's doing very, very well.
We'll be happy to see the crew in a moment.
They're here right now. So
They're there?
very much.
That's all right. You did a great job. Congratulations.
Okay, thanks.
Thanks, Yvonne. Bye-bye.
Good.
Oh.
Congratulations.
She's like, the head is coming and I don't know how to use speakerphone. I was like, abort mission.
So she was the grandmother.
That was Grandma. She couldn't use speakerphone and she was freaking out and she wasn't repeating what I was saying. So I had to to get her to do it. And she said the head was stuck and I was like,
Yes, I heard her say that. Oh my God.
My heart went, please be the head, not the bum. Being a mum, like you having a heart attack at the same time because you're having to deliver someone else's baby, I always find that I'm a bit weak at the same time. Because I know like the other side of the story when the baby isn't breathing and the baby gets stuck. Yeah, I lost my baby at full term, 3 days over during labour. My pelvis had to be disconnected and my baby's collarbone broken to deliver him when I had a 3rd term hemorrhage during that birth as well. So it became one of those really scary births that you don't want to tell people about. And I was only 18, so I kind of relate to the young ones and the scared ones, and I know that I would feel it greater than some other EMDs because I've been through it if it goes bad. So yeah, I just try and make the best of it, try and control the call as much as I can and get baby out safe, whatever I have to do. Ambulance, what's a town or suburb of the emergency?
It's the beginning of the Saturday night shift.
Just take some deep breaths for me. We're going to get some help for you, okay?
And about how long ago did he start choking on the meat?
So what's the main concern tonight? So the fact that he's fallen off the bed or that he's having trouble moving his bowels?
On average, the Brisbane Operations Centre can expect to dispatch paramedics to an incident every 64 seconds.
Well, he should have heard Jerry before. He's like, as you can appreciate, it's very busy being a Friday night. And I'm like, Jerry, it's Saturday.
I was like,
But tonight...
501324, go ahead.
In addition to caring for Brisbane's population of 2.4 million...
Extremely intoxicated, vomiting non-stop, had cannabis as well.
Ambulance crews are on standby to provide emergency assistance at 2 major city events, River Fire and a music festival, drawing 500,000 extra people into the city.
And also because the
Bridge is shut.
bridge is closed.
So we need a south side crew to get across to him.
Yes.
Okay.
So you'll need a south side crew.
601457 logged on Balmoral night shift.
457, ready 5 out of 5. This page coming through now. Have a good night.
Thank you. We're just going to head out local and hopefully watch the fireworks for a bit if you haven't got any word for us.
Clocking on for their 12-hour shift are paramedics Sarah and Alicia.
Saturday River Fire.
Woo!
I know. Hopefully we can see.
At least
just a little bit.
Maybe if we get a job in that direction, so as we're driving towards the job, we can see the fireworks.
Yeah.
Oh! Oh! Oh, there is some. Yay! Oh, wow.
It's going to be a fantastic night.
All right, he's passed out. Okay.
I'm not a doctor. I can't explain it.
Don't yell, please. I know you're not a doctor, so just asking you to describe the symptoms that you have at the moment.
I'm not feeling good.
Yeah, so when you say you're not feeling...
Look, how about I just lay on the ground in the middle of the road, then you just come get me?
So his ankle was sliced open on glass.
Ambulance, what's the town or suburb of the emergency?
121, go ahead.
The music festival has been in full swing since midday. The operations centre is experiencing a surge in the number of calls.
I've tried MDMA tonight for the first time and I'm not in a good state.
Most involving the drug MDMA.
I kind of feel like I'm overdosing.
He's been in and out of consciousness, eyes rolling to the back of his head. She's not doing any drugs tonight, she's passed out.
My heart was just going from now and then. Now it's just hurting for something there.
Brisbane paramedics are dealing with the rush of MDMA overdoses.
She's taken MDMA at about 1900 hours.
In car 6457, paramedics Sarah and Alicia are attending to two 19-year-old males. One is in a serious condition and needs to be taken to hospital.
Have you had alcohol since then? Yeah. Any other drug? Okay. Weed, yeah.
On the other side of the river, in car 5451, Ben and Rachel are transporting an 18-year-old female to hospital, suffering heart palpitations.
Were you worried you might end up like one of those young girls that die?
I'm going to be one of those people who overdose. This is fun.
And just confirming it was MDMA that you've taken. And so he was just drinking in the valley? He didn't take anything? Okay, so he took 2 MDMA.
Tonight, drug-related incidents have doubled from a regular Saturday night, stretching resources to their limit.
Sierra 415, go ahead.
451 on your channel for code 1.
326, what are they on?
Have you paged them? Have you heard anything from them? I need them for a code 1.
Booze. I have no cars.
Code 1 indicates a time-critical, life-threatening emergency.
Common call, QS to all units. Common call, code 1, Alexandra Hills.
A common call only goes out for critical cases when there are no available ambulances left in the city.
So any crew that's got their radio on and they're listening, they might be able to clear up at hospital and put their hand up and say, yeah, we can go, because it's code 1 that's pending, and we can't really have them pending.
Common call, common call, common call.
Unit available to see code 1 to Green Slopes for an RTC.
When you hear common calls over the radio, though, you know that it is crazy out there.
Patient has self-extricated.
601 451 on your channel for code 1.
Attaching them now.
Ambulance, what is the town or suburb of the emergency?
We don't have a street address. We're at a bus stop. I called previously for an ambulance that hasn't arrived.
Okay. And you're near a bus stop?
22-year-old male in the bus stop 6.
601 457. We've just been flagged down by those guys. I'll just stop and have a quick chat to them and I'll give you an update.
Was that legit?
Yeah. Cheers, thanks, 457.
Sarah and Alicia are already full with two 19-year-olds they have just picked up.
My name's Sarah. I'm with the ambulance. Tell me what's going on. You can come and have a sit back down.
We're just going to have to get another ambulance because we've got someone on our stretcher. Come and have a sit. Yeah, we've actually got a patient on board, so... What has he had tonight?
Earlier on at the house, I believe one of our housemates gave him thoughts, protein.
Okay.
And then a little bit of MG, like minuscule amount.
Okay. Do you know how much?
Tiny.
Just left upper quadrant abdo pain, started while he was walking across the bridge, has had MDMA and alcohol.
It's a theme.
Yeah.
With no available ambulances to attend to the patient, Sarah and Alicia need to find a solution.
I mean, he could sit in the patient care seat and I could stand.
Drugs frustrate me, particularly on nights like tonight when I know that they're taking up lots of resources. Any sort of music festival, if even 1% of them called the ambulance, that's going to take up every single ambulance in Brisbane. 601-457, sorry to interrupt. We've managed to get the second patient into the ambulance as well. We're going to transport both up to the MARTA.
Thanks, guys. Thanks for your help in the city tonight. Hopefully we can get you back north.
We often hold our tongues and sometimes you just go, I can't do it. I can't hold my tongue anymore. I just need to lecture these guys.
You three need to stop taking drugs.
But you don't judge people for what they do. When they're not well, they need an ambulance. So we get them a car.
Ambulance, what is the town or suburb of the emergency?
I exercise very much, and therefore I really push myself.
A caller named Francis has rung 000 3 times. The high demand from drug overdoses is putting a strain on resources. He's been waiting almost 2 hours for an ambulance. This is his 4th call.
I'm in pain.
Oh, right. Well, I'm just going to get one of the paramedics to have a quick talk to you, OK?
Worried about the wait time, call taker Jared transfers the call to Clinical Deployment Supervisor Nathan. A qualified paramedic, he'll reassess the urgency of the job.
Are you the patient we're coming out to?
Yes.
Whereabouts are you in pain?
All over my body.
Okay. Can you be a little bit more specific? Is it more to your legs? Is it in your chest? Is it in your head?
My feet.
Your feet. Seems more like a chronic issue. I have upgraded, it was a 2C, so like a really low acuity, and I've upgraded it to a 2A just because of the time. So we'll try and get out to him and see if we can help him.
Sore feet from exercise. He's having difficulty mobilising because he's got sore feet from exercising? Is that what you got from that?
Yeah. When you decide to do this job, I think most people think about the critically ill people and people who are about to die and the really life-saving stuff that we do. The more you do it, you realise it's not all about that.
It's not a call that you expect when you think of an emergency service, having sore feet and trouble walking. So I think the fact that he's called, that makes me think that maybe there's more to it. Maybe there's some social stuff. Maybe he's just not very well educated in how to look after his own health.
Yeah.
Be interesting to see.
I grew up on a farm west of Brisbane, near Toowoomba. When I left school, I went to study science. I thought I wanted to be a researcher, and then quickly realised that the career options involved a lot of sitting inside, doing the same thing for many years, and then this job just popped into my head, and I love it. It's the best job in the world.
Second floor. Hello, sir. What's your name? Francis. My name's Rachel. This is Ben.
Hello, sir.
Are you our patient?
Yeah.
Have a seat somewhere for us so we can chat.
If the job's at the back of the house or in a further room, I'll be having a look around to see how neat, tidy the house is. That's going to give you an eye of the social demographic that I'm working in. It gives you an idea of the living situation. And of course, everyone's living situation is going to impact how they're managing their own health.
Francis, tell me a story, mate. How can we help?
I really pushed myself exercising.
Okay.
And I've been aching ever since.
Right.
I'm just wondering if you can get painkillers.
Well, can I ask some more questions first?
Yeah, of course you can.
Thank you. If you bring any judgment into a job, that's instantly going to give you some bias and maybe make you not make a very good assessment. What kind of exercise did you do?
Squats.
Squats?
I pushed myself to the absolute limit. It does your whole body.
It does do your whole body. Yeah, they're not my favourite activity.
Oh, they're hard.
How many do you reckon you did?
1,000 and half an hour.
Empathy is very important on cases like this. You've just got to remember that everyone's got their own story. The same way that all of my upbringing and life experience so far make me, everyone's got their own version of that. Francis, do you normally have any medical conditions?
Yeah, I'm schizophrenic.
Schizophrenic, okay. What about problems with your heart or your lungs?
No.
All right. Now, as for what we can do for your pain, this is about all I can give you for pain is Panadol.
I knew that.
Yeah. I'll give you those two. All right. Now, given that us as an ambulance can't give you anything for the muscle pain, that's about all we can do.
Yeah.
If you wanted to go to hospital, we'd be happy to drive you, but...
I don't think that's necessary. It's not going to get any better.
The other thing that we could offer you tonight is a phone number for a service called Support Link. And they have a number of services to help you around the house if you need it. I think our job's quite unique in that we are one of the only medical professionals that actually see people's living environments. So I think we have a duty of care to assess that when we're there, and if we deem it to be, potentially not ideal, it's our role to, I think, at least offer some support to those patients. Maybe you should give yourself a break from the squats for a couple of days.
Doing less.
Okay, I think that's a good plan.
Just 500.
Just 500. That's still a lot. It's more than I think that's more than I've done collectively in my life.
Yeah.
So how do you do the best kind of squat? You got something like that?
Yeah.
Do you put your hands out?
No.
No? Just by my side?
Yeah.
All the way down?
Yeah, that's a bit too far.
A bit too far. Somewhere in the middle. I can feel the burn already. I don't know how you did 500. All right. Pleasure to meet you, Francis. Take care, okay?
Okay.
Look after yourself.
All right.
I love this job because it strikes this good balance for me where I still get to use lots of critical thinking, and it's a very scientific job in one way, but at the same time it's very much a personable job where you just talk to people in the community, anyone from little kids to 40-year-old drug addicts to little old Nana who lives on her own. So yeah, there's not many jobs I think that hit that sweet spot the way this job does. Yes, amazing. That was one of the poorest living situations I think I've seen in this city, in this job.
Same. Ever.
Ever.
Yeah. I would have been equally surprised if I walked in that room and I saw you squatting or him squatting, and it was you. You really go the extra mile.
It's like there's not a lot I can do medically for that job, but I may as well have a laugh with him and make him smile. Like, there's nothing else to do.
Laugh, at least.
That's where I get the enjoyment from this job half the time.
Yeah.
It's just talking to people like that.
Ambulance, what's the town service?
Okay, so when he fell from the seat, did he injure himself in any way?
At the Brisbane Operations Centre,
Hi, did you just call for an ambulance?
the Saturday day shift has started with a rush.
Has she taken a breath?
Tell me exactly what happened.
So he's taken 2 tabs of LSD and he smoked some weed and he's just freaking out.
Why do you need the ambulance?
I'm not feeling all right. I crushed my cuff.
The Queensland Ambulance treats 3,800 patients every 24 hours.
And is there any serious bleeding?
And answers more than 2,600 000 calls.
Ambulance, what is the town or suburb of the emergency? I've got an ambulance on the way. Tell me exactly what happened. I was driving and a motorbike went around me on a corner. Yes. He lost it on the boost gravel and then he came and tried to correct and then he jammed the brakes on, but he just didn't have time to stop. Does he appear to be completely awake? He's completely awake. He's in shock and pain.
On a country road south of Brisbane, the crash is high speed and high impact. Ambulance 426 with 2 advanced care paramedics discover the scene. Multiple other crews, including Ambulance 647 and critical care paramedic Car 337, are quickly dispatched. Car 414 with high acuity responder Aaron, who specialises in the most extreme emergencies, is 30 minutes away.
I guess they're just unforgiving. Like, if you come off your bike, the injuries can be quite devastating. There's just got no protection.
Nationwide, motorcycle riders account for 19% of all road fatalities.
Compound fracture to left leg, heart rate of 140, query, pneumothorax.
So just based on that last sit rep that came through, I'm a little bit concerned that he may be deteriorating.
A pneumothorax is a collapsed lung caused by an internal puncture wound from broken ribs.
The biggest concern is the accumulation of air in that chest cavity, and that collapses the lung and it exerts pressure onto your heart, and that can rapidly lead to death if it's not treated quickly.
QAS Medical Director Dr. Stephen Rashford has spoken to the first responders and calls with an update.
Hey, Steve.
Yeah. I just had a look at him on FaceTime.
Okay.
He's got severe chest injuries. I'm just talking through decompressing his chest.
Yep.
He's going to need to be RSO. I'll wait to hear back from you when you get down there. He's so sick.
Okay.
Okay, how far was Cino?
Still about 15 minutes, I'd say.
The patient is in a critical condition. The sooner Aaron can treat him, the better chance he has of survival.
Roger, thank you. We'll depart shortly and meet en route.
Roger, that's awesome, thank you.
To save time, Ambulance 426 with the critical care paramedic on board must now transport the patient to meet Aaron halfway.
I've been a paramedic for several years now, and it's one thing that I appreciate is how quickly the situation can change and how rapidly a patient can change. As I approach the scene, I have a sense of confidence. I think if you're calm, the team's calm. Hey mate, my name's Aaron. I'm just another paramedic here to look after you, okay mate? You're right mate, we're just giving you some more pain relief, okay? We're looking after you, mate. Feels like he's got some fracture ribs there too. Sorry, mate. So I'm just gonna make a phone call, Paul. If you want to keep just running this. How old is he? 26. Thank you.
Air and blood are leaking inside the man's chest, building deadly internal pressure on his organs.
Hi, Steve.
Yeah, mate.
So this gent's GCS 15 is in obvious respiratory stress. He's got a flail right chest. His fast is negative. His pelvis appears symmetrical and in line, and he's got a compound distal femur fracture that's been reduced. So the plan currently is to anaesthetize him and do a finger thoracostomy on that right side of his chest. I want to set up the blood.
These are high-risk procedures to perform on the roadside, but without them, the patient could die within minutes.
I'm going to take really good care of you, mate. My name's Paul, mate. I'm going to take really good care of you, mate.
South of Brisbane, paramedics led by high-acuity responder Aaron are attending the scene of a high-speed motorbike crash.
We got all the ketamine we should need for the induction.
The rider's fractured ribs have punctured his lung, leaking blood and air into his chest and building pressure, which will soon be fatal if not released.
So just so we're on the same page, significant chest injuries. He's imminently challenged. So the plan is we're going to anaesthetize him and we're going to do a right-sided finger thoracostomy.
A finger thoracostomy involves an incision from outside the ribs into the chest cavity so that any air and blood compressing the lungs and heart can be drained.
Block uranium, 100 milligrams in 10 mils. 2020, just repeat and see what you see, and then draw that up neat.
Really good care of you, mate. We're going to drift you off to sleep in a minute, take all your pain away, okay?
Paulie, just verbalise your airway plan.
Yep, so airway plan is going to be one attempt at intubation. I'm going, look, I'll tell you what I see. If I can't visualise or have problems, we'll come back out and go back to bag the airway.
Yep. Right, Paulie, you happy? Everyone happy? Everyone know their role? Anyone, any questions?
Happy to move out the back belt mask now, mate?
Yep. Okay, we'll just give that 30 seconds to take effect. Ring the scope.
Paramedics need to help airflow into the man's lungs.
Once you press the drugs and we intubate him, you can come around and just hold his arm up as well.
But the lungs will only inflate normally once the pressure outside them is released.
Good. Yeah, Burgie out, watch your eyes. So I'm just going to do his chest now.
Do you need the bag belt mask feels firm, the ventilate.
Yeah. So for the rib, pierce through the pleura, just opening up. It absolutely is a time-critical condition. Each breath, more air is tracking into the chest cavity, which is collapsing the lung, pushing up against the heart, which can lead to them going into cardiac arrest. Easier?
Easier.
Yeah. All right. Yep. Lungs up, Paul.
The leaked blood and air collapsing the man's lung is drained.
Now, so circulation, Gregorian pulse is tacky as we'd expect.
But the pressure could build again at any time.
So we've always got to be thinking and planning ahead, always thinking about the worst. And if that happens, what we can do about it and have a plan A and a plan B and a plan C in place for that. Ready? Yep. Right, good to start rolling.
It's a 40-minute drive to the nearest hospital.
That's right. So we're just going to keep the mask, go laryngoscope in case we need it. I can refinger the chest from here, that's not a problem. Left seems fine. Okay.
That's time to head off, thank you. Yep, thank you. It's a nice safe drive.
This is like the pinnacle of pre-hospital paramedic work. And I think that's what this sort of unit's about. It's identifying those immediate needs that would have killed someone 5-10 years ago, which now they're surviving because of it. I'll redo the fast en route, but he doesn't look like he's bleeding, does he? Although he's got very pale.
He looked pretty clinically shocked when I saw him.
Very pale.
To die already.
Broken rib, that's nice. Just ventilate. Ventilate. I can feel his lung, but it is down there. Keep ventilating. Ventilating.
The collapsed lung is stabilised, but the patient's condition is still critical. He may have other injuries that can't be seen.
Right side, the lungs up. Left side, we're still getting rise and fall, but it feels a little bit tight on the bag. Yeah. His heart rate's been persistently 150 and his blood pressure is slowly trending down. This patient is showing signs of shock of an elevated heart rate and decreasing blood pressure. He is at risk of cardiac arrest.
Again, Aaron consults Medical Director Dr. Stephen Rashford.
Hey Steve, I'm just trying to run by you. So, intubation, everything went fine. Got the right side thoracostomy, lungs up. Left fast is still negative. Blood pressure is slowly trending down, and he's persistently tachycardic. So he might be actually bleeding somewhere. He's got a large pneumothorax sort of thing. And I do want to give him some blood. He's only young and he's pumping along at 160. Are you happy with that plan? Yeah, that's it. Okay, great. Thanks, Steve. Bye. So I think volume's the first thing. We've still got, what, 20 minutes till we get there.
Without extra blood, the man could go into cardiac arrest before reaching hospital.
Just check the number on it. Then open it up. You know, have it upside down and then pull it off. Yep. And then push it in the blood. Keep squeezing, keep squeezing. I think about it as just an internal drive to be able to do the most I can pre-hospital and push those boundaries and see what we can achieve. Let's just see what his radial pulse is doing. Starting to go in the right direction. We always want to help more. We'll be able to do more, and this is just an opportunity where I'm afforded to do that, which is... Yeah, his heart rate's come down a little bit. It's down to the 140s. Yeah, good work, good work.
Give clear passage on 3. 1, 2, 3, coming out.
Potentially save someone's life is incredibly exciting and rewarding. And I'm confident we're giving him every chance of a good outcome.
Ambulance, you're reporting an emergency?
It's Saturday night, often the busiest night of the week for the ambulance service.
Tends to be a lot more alcohol-related calls, a lot more violent-related calls, a lot more drug-related calls. So, yeah, it tends to be quite a busy night.
So is this a suicide attempt? Threatening? Okay.
You've been speaking with God?
Yeah, I've got all the answers.
Yeah? And I'm sure he'd want you to move away from the balcony as well.
But he's not a he, he's an alien.
He's an alien, is he?
Yeah.
Okay. Okay, but you stay where you are, okay? We're going to come see you there. He's talking to God and he has 10 galactic warriors with him. He needs some help.
Over the past year, emergency calls for mental health issues increased by almost 16%.
It's my partner's son. He's adamant he's the Antichrist. He thinks the government's going to kill him.
Okay. Would he be violent towards the paramedics? Okay.
Okay.
Barry, you don't need to yell at me. I'm here to help you, okay?
In car 416, paramedics Arman and Ashley are standing by for their next job.
Oh, it's a baby possum.
Oh, it's a baby possum.
Can they survive without their mum?
I don't know. What do we do with it?
I'll get him off the road.
Okay. We're always saving animals. Get a blanket. I think we need to move it somewhere.
Keep going.
It looks so tiny. It's cute. Look at him. Should we put it in some bushes?
Oh no, he's gonna touch me.
Just wrap it back up.
Let's go to the tree.
Ah!
Oh, shit.
What do we do? Do we just leave it? Oh, it's like running.
I'll just call Manly Road. Hey, my name's Aman. I'm from the ambulance service. We just seen a possum, and he's just walking around. But I put him in a bush, so he's safe, but maybe his mum's around. I don't know. Fake.
Oh, he's too little.
So they stay with their mum up to 2 years.
Oh, maybe we can check back later.
Ambulance, what's the town or suburb of your emergency?
Overdoses, and my friends are making me feel an ambulance.
And where are you right now?
In my house.
Are you feeling violent at all?
No.
Do you have a weapon there?
No.
25-year-old female who has taken an overdose. She has taken multiple Valium and multiple Seroquel.
The emergency call is from a patient who has taken a drug overdose in a possible suicide attempt. Last year, paramedics responded to more than 20,000 calls for abnormal behaviour or suicide attempts in Brisbane alone.
She's on Seroquel, so most likely she has a schizophrenic-like mental health history.
Take her to PA and she can see mental health.
Mental health and get medically cleared.
Yeah.
They'll do a tox on her, but...
She can talk to someone who can help her out, give her the help she needs.
And I have a lot of experience in acquaintances and friends committing suicide, so I have a pretty strong understanding of different little things with mental health. Mental health can affect anyone and everyone. I've had anxiety most of my life, and that's what I have to deal with day to day. It's just how my brain works. No one has the same trigger point. No one has the same reasoning behind why they have that certain mental health illness. Most likely the one on your
side.
Okay, left.
She's sitting outside, just get her in, but up on the stairs here.
I've been to her before. Getting to these mental health cases is very important. To be blunt, the worst case scenario is that person hurts themselves or then they're dead.
I'll get the stretcher ready.
Yeah, I'm just gonna have a chat to her now. Am I here for you? My name's Aman. Ash is in the car as well. What's been going on?
I OD'd. Like a sleeve and a half.
It's like 10 and 15?
Yeah, like 50 milligrams and then like a sleeve of 100 milligrams of Seroquel.
Why is that?
I just was dissociating and really triggered.
I'm sorry that's happened. Do you want to get into the ambulance and have a bit of a chat? Are you happy with the PA? Yeah. You've been to the PA before? Do you understand the rules and regulations that I have to put you on paperwork and stuff like that? I'm sorry. But
And I have really bad pains in my stomach.
do you know why?
No.
Probably because you're taking those tablets?
Yeah.
Cool, let's go. Do you just feel drowsy? Yeah. Do you have anything on you that can hurt me? Are you gonna hurt me? Oh, appreciate it. What's your name, sorry?
Bridget.
Bridget, like Bridget Jones' diary?
Yeah.
But no diary.
Just going to check your temperature in your ears, sorry.
If you don't mind me asking, what's your medical history?
Bipolar, complex PTSD, and anorexia.
How's it all going lately?
Shit.
I'm sorry to hear that. Do you have a counsellor, psychologist?
My psychiatrist is away skiing in Japan.
It's good for her, but not good for you, I guess, hey? There is a big stigma around mental health. When someone breaks their arm, there's no stigma behind breaking their arm. If someone is having a mental health crisis, there shouldn't be a stigma behind it. The person's having a mental health crisis and they need a little bit of help, same as that person, if they broke their arm, they need a little bit of help. May I ask why you did this tonight?
I was...
I know you're triggered, but...
Dissociated.
Did you?
Sleep, not wake.
Okay. Did you want to end your life tonight?
Yeah, but I called my friend and she's like, get in for an ambulance, so I did.
I appreciate that. May I ask next time, if you start feeling like this is going to happen, just give us a buzz. And then hopefully we can catch it before you do the OD, and then we'll just take you up and you can go to mental health and have a chat rather than you have to go to get toxicology. Yeah. As a paramedic, my job isn't to judge somebody. My main part of my job would be to empathise with that person. And with me, with anxiety, I kind of can understand a little bit where they're coming from. It's not easier for me, but I feel proud to go to them and try to help this person so they don't feel like there's a stigma against them. They don't feel insane, they don't feel crazy. They just feel like that they're just going through a little bit of a crisis and need a hand that day. There's an extra safety net with QAS, yeah, and we're always going to come out and have a chat with you. Yeah. And then we're always going to see where we should take you, yeah? I'm glad you called tonight.
Aman has a really good, calm approach to mental health patients, and he's good at building rapport with our patients in these troubling situations that they're going through.
How drowsy do you feel?
Pretty drowsy.
I would love to be able to change the stigma, but I'm only one person. I think that will take a generation to change, and I think we're getting there with all these support services that we do have. Did you want to stay on the stretcher or do you want to walk?
I'm gonna stay on the stretcher.
You can stay on the stretcher. We have a long way to go, but with the stigma, I think it can be slowly broken.
Ambulance, what's the town or suburb of the emergency?
8 p.m. The operations centre is 2 hours into a 12-hour night shift.
Okay, so when you say spikes, like, is that he had his drink spiked? Yep.
Her car upside down. He's flipped it and he's trapped inside it.
Broken champagne bottle has smashed onto the ground and then come back up and hit her in the eye.
Busy, yep. Everyone wants an ambulance.
So far, 250 emergency calls have already been attended.
Ambulance, can you tell me exactly what's happened?
I've got a gallbladder problem and I'm just having a really bad attack at the moment.
In Nathan, south of Brisbane, paramedics Ben and Rachel are dispatched. They've worked together for 2 years.
Just forgot what the siren sounded like, did you, mate?
Oh, jeez, man.
It's a bit of a reminder.
Couldn't breathe.
There's a special kind of bond that you develop with someone when you are with them for 12, 13, 14 hours a day.
Partial pressure of oxygen here dropped to about 19, I reckon.
That bond that you have, it lets you cope with what's going on, it lets you have a laugh, and it's the difference between having a bad day and a very, very good day.
All right, we've got a 54-year-old female under attack by her gallbladder.
Oh, is that what it says?
A gallbladder attack.
Oh, dear.
It's less dramatic.
Kidney stones and gallstones are two of the things that people seem to be the most pain in.
Yeah, I mean,
when they're genuine. Like when they're a full-on one, they look terrible, sweaty and pale and...
Yeah, I agree.
I think it's this one. Oh, boom. Right on the money. Oh, lights on.
G'day, mate.
My mum is on the couch.
Oh, thanks.
Oh, God.
Hello, ma'am.
Oh. Oh.
What's your name?
Renee.
What's going on today, Renee?
My gallbladder.
Mm. You sound pretty sure.
100%.
Right. So you're suffering with pain, obviously?
Yeah.
Whereabouts?
Just under here.
Okay,
Under
right.
here. It's all around. I've had it before.
So you had a lot of attacks?
I've had 4 in the last 3 weeks.
Okay.
Oh.
Right. And how does this rate compare to those ones?
This one's a bad one.
Okay, sure.
This one's bad. Oh.
Would you say it's sharp, dull, burning?
It's killing me.
Yeah.
Oh.
Okay. Does it radiate anywhere else?
It's just all underneath.
Okay, sure.
Oh.
Does anything make it worse, like movement, breathing?
Yeah.
Everything?
It hurts to breathe.
I'm just going to give you the green whistle, and then I'll put a needle in your arm and give you another drug, okay?
I imagine this is a really challenging situation for someone like Renee, who's torn between looking after her 2 boys and also looking after her own health.
And you're going to breathe, so put that in your lips and breathe it in slowly at first, a small breath, and it tastes quite bad.
She's trying to stifle her pain and hide it from her 2 sons. And it seemed like she was really trying to protect them from that.
Take deeper and deeper breaths into your lungs. Hold it for a second and then breathe it out. When you breathe it out, try and breathe it out through your nose, but not back through the whistle, because it'll blow some of the gas out. And while we're talking, Rachel's just going to put a needle in the back of your hand, and then I'll give you some morphine as well, okay? And then we'll take you to hospital.
All right, sharp staying okay. Just keep this nice and relaxed for me. That's the way.
How many children do you have here? And will they be all right, or is someone able to look after them?
My husband will come back.
Oh, how long will he be?
Anthony, call your dad. Okay.
Will they be all right for a little bit of time without him? Oh, good, okay.
I really admire families like Renee's.
A bit of a sting in the back of your hand, okay?
Dad's at work, mum's looking after the boys, and even when she's unwell, the brothers are leaning on each other for support.
Is the pain feeling better?
Yeah.
Oh, good.
Is this Andrew, is it?
Yeah.
There you go, Andrew. Got some strangers in your house. We'll be out of your hair soon, so you can have dinner. And we've given Mum lots of medication to take her pain away, hey, Andrew? She'll be feeling good soon. She already looks a lot better.
You may not have heard it, but he said thank you. So he has certain ways of him saying thank you.
Yep. Is it with its like sign language stuff?
Yeah.
Oh, cool.
Yeah.
You're right, mate. We'll look after her.
Is there anything we can help you grab, like a
Does this bag come in this?
Yeah, I got my son
Oh, he's
Gee, he's good.
sounds set to look after his brother there.
Oh, mate. Seems like the best brother in the world.
He's all over it.
Mum's up and about, Andrew. She's looking a bit better already.
See you, boys.
Thanks for your help, guys.
Thank you. Bye.
I think the way Andrew and Anthony interact with each other and care for each other really says a lot about the kind of parents that Renee and her husband are and how well they've raised them. And it sounds like they've got things under control. If Mum trusts Anthony to look after Andrew, then that is enough for me. Going. And that's about perfect.
Is it less than an 8 now? 6? And you've never had a pain so bad? Gosh. Worse than childbirth?
Yeah, only because it was continuous.
Right.
At least with childbirth, it stops.
And there's a happy end goal there. You're not going to deliver a nice, bubbly gallstone, are you?
Gee, you have a way with words, mate.
Thanks.
How long have you been doing this for?
4.5 years now. Getting along.
You also have an awesome manner.
Oh, thank you.
I love this job because it's different every day. You get to speak to people from all walks of life, and when something goes wrong, I think it's a real privilege to be called and trusted to help them out.
Tell me exactly what's happened.
I just started spitting up blood. And I'm just a bit concerned about bleeding.
Sure.
So you've got the ambulance on beside there?
Yep, no problems. We are experiencing a really heavy workload at the moment, just with lots of life-threatening emergencies. As soon as we get a crew...
life-threatening?
If you're only spitting up small amounts, it's not, doesn't sound like it is life-threatening at the moment. But we'll get somebody there as soon as we can.
It's 10:30 p.m.
There is a chance that you may be waiting quite a while this evening.
The operations centre is under siege.
No, that's okay.
With high demand,
Just reassure him that help has been arranged.
repeat callers,
They haven't come yet. Unfortunately, we do have an extreme workload in the area.
and an already long waiting list putting strain on call takers and dispatchers to clear backlogs.
So you said that she's having abdomen pain and she can't, difficulty breathing, is that correct?
Normally, the operations centre averages a new call every 70 seconds.
So you think she's having an allergic reaction? So her body's all red at the moment. Okay.
Tonight, it's been every 45.
Yeah, I understand the ambulance is coming, lights and sirens, okay? It's coming as fast as it can, but we need to help her until we get there, okay?
It's not just the increased call volume that we get to have these jobs. It's increased even more because so many are being delayed and they're calling back to go, where is my ambulance? Ends up being quite a busy night.
I've already called one, just spitting up blood, and I'm like, can you get your stomach lining?
We're trying to get an ambulance to you.
Well, how long?
I have no idea. It depends if somebody has a car accident, we're on the way to you, or somebody has a cardiac arrest. But we're trying to do the best we can to get to you.
So he's had a white-tailed spider bite, is that right?
About 3.5, 4 years old. He's just got too much pain and put up with it tonight.
Okay, so the spider bite, did that occur tonight?
No, I'm just about 4.5 years old.
Okay. All right, I understand. Okay.
When you say you're feeling a bit funny, what do you mean? What sort of sensation do you have? Oh, okay. We'll be there as soon as we can, okay? Sorry. Bye-bye. 3 bottles of wine will make you feel funny.
Sorry, I'm just getting a blood guy.
Yeah.
And I think I've just formed a stomach lining, so you won't die from that, you reckon?
Okay. Have you called before?
Yeah, and I'm worried it's getting worse.
I've just advised the ambulance. I do apologise. We've been extremely busy today with people who are unconscious and not breathing, okay?
Yeah, but I'm really close to that too.
You're close to that?
Yeah.
I've just updated the ambulance there, okay? We'll get out to you as quickly as we can, but if anything changes, you call back on 000.
Can you stay on the line for me, please?
I have to disconnect to take other life-threatening calls, okay?
Okay, so they're coming on their way now?
Yes, they're on their way, but if anything changes, you call back on 000.
Okay, thank you very much. They're on their way now.
They're on their way now. Just a newbie. But I'm loving it. It's good. It's good fun. Originally, I was working in KFC for 6 years. So I learned all my people skills at KFC. Yeah. Certainly a different job than what I've been doing previously. I'm just selling, you know, chicken and chips to people.
Can you tell if he's changing colour with the dark?
I'm going to get an interpreter, okay? Can you stay on the line? Don't hang up.
Are they actually arguing or...? Yeah, it's probably better if that young man is not involved in any confrontation with the car driver. So just tell him, just let the ambulance officers sort things out and just get him to sit down and rest. Think, oh, those poor people, are they in pain in some way or, you know... I just wish we could get to them more quickly.
Ambulance, what's the town or suburb of the emergency?
My daughter's woken up. She's 3 years old. She's struggling to breathe. She's got a history of asthma. Yeah, she just won't stop trembling.
Yeah.
She's just not responding to us talking. She's just...
Because she's in the distress, yep, okay.
Yeah.
We've got an ambulance arranged, lights and sirens, okay? I'm going to stay on the line with you for as long as I can. Watch her very closely and look for any changes.
Yeah.
Alright, so you're still using the puffer there?
I think my wife's just gone to grab it. It's okay, sweetie, just lay there. It's okay. I know. Sweetie, you're okay. You're okay.
Alright, so just keep administering that medication there, the puffer, when it's necessary, okay?
Yeah. Are they close by?
Look, because we've been extremely busy, we've had to send one from a little bit further away, but they're getting really close now.
Oh, his face is all puffy.
Just try and reassure as best you can.
Yeah. Can you talk, sweetie? Can you say something?
Is she getting any relief from that medication?
It is a little bit.
That's good.
Hello. Hey, how you going?
Is that the paramedics?
Yeah.
All right, I'll leave you with the paramedics. You've done really well.
All right, thank you.
Bye-bye.
Bye.
Oh, my God. That was horrible. That was really, really bad. No one calls 000 when everything's perfect in their life. So being there when things aren't perfect in their life, it's fulfilling for sure. helping people. I think that's why a lot of people do the job, is just to feel like they've done something and helped people when, you know, they're at their darkest times.
It's after midnight in the Brisbane Operations Centre.
Okay, tell me exactly what's happened.
Call rates are now coming in at one emergency every 2 minutes.
Ambulance, was a town or suburb of the emergency?
Is this the ambulance?
Yes, this is the Queensland Ambulance Service. What is the town or suburb of the emergency?
Look, I'm hard of hearing, sorry.
Is there any serious bleeding?
No, he's breathing okay.
No, not breathing. Bleeding, like blood.
Oh, no. Ambulance, what is the town or suburb of the emergency?
I cannot get up from this bed and I'm almost dying.
Our ageing population is now one of the largest challenges facing the healthcare system.
And she just suddenly flopped over and eyes rolled in her head, and now she's not very responsive.
Okay, you said 102?
Yeah, she is 102, yeah.
20% of emergency calls needing an ambulance now come from elderly patients.
An elderly person will have like a fall in the night and sort of just be stuck on the ground, no like particular injuries, but just stuck there. And they'll always ring towards the end of night shift and they're like, oh, we didn't want to wake you up. Can you come out now that you're all up? And we're like, we're up all night. Like, please ring when you hurt yourself. They're so precious. I just want to drive myself and get them. I'm on my way. Yeah. I finish in 10 minutes. I'll be there. They're too cute.
Ambulance, what's the town or suburb of your emergency?
I'm coughing like bloody crazy and I can't stop. It's been going on for about 4 hours and I'm frightened it's going to damage my heart.
Yeah, we'll get some
because
help.
I have a bad heart.
You got a bad heart, do you? We'll get some help out there for you. Now,
Thank
you said
you.
you're 88?
Yes.
Right.
I wouldn't bother you, but
Definitely
my
not a
heart's
bother
in
for
such
us.
a bad condition.
Never think that you're a bother giving us a call, okay?
Yeah.
Yeah. That's why we're here.
The call has come in from Mansfield. It's Rachel and Ben's fourth job of the night.
So we're going to an 88-year-old male. Recent chest infection, has finished antibiotics and cannot stop coughing.
Yeah, right.
Yeah, I'm going to be wearing my mask into this one, mate.
Oh, yeah. It's a good idea.
Yeah, it is a good idea.
Some of these elderly patients are some of the sickest that we see. Their bodies are ageing and they leave it a long time. So by the time we get to them, they can be quite unwell.
20 minutes away, Mansfield.
And on top of that, they're often socially isolated or they don't have a lot of support. But they're also this really tough group of people who don't like to ask for help. They don't want to be a burden on anybody. And that's not a great combination because you've got people who are more likely to have problems and issues.
Mask on.
One of the important parts of dealing with the elderly is to not only assess the medical side of things, but also assess the living environment, social stuff, and pass all of that onto the hospital so that they can figure out an appropriate management plan for that patient.
Hello, sir. And it's John, isn't it? Yeah. Oh, Joe. Joe. I understand you're a bit under the weather at the moment.
I'm very...
Joe, do you want to come to the hospital today?
Look, I think it'd be better because it's only the wife and myself. We're both the same age.
Right.
And...
Okay. 38.4. You're a bit warm. And you've recently had a chest infection, Joe.
Yes, I have. I went a week and a bit.
What's that sound I can hear out there?
Another. Oh, that's Charlie. Hello, Charlie.
Charlie. Oh, hello,
Hello, Charlie.
Barrett's got a chest infection as well. Oh. That cough that you get when you're a smoker and you have a chest infection is a really distinct one.
He talks quite a bit. Come on, Charlie. Come on.
Hello.
Come on.
To find out that it's not a human, it's a bird, you can't make that stuff up.
Go back on your perch. Good night, Charlie.
Oh, good night, Charlie.
Good night.
That's amazing that he's started to cough at you. Those quirky aspects really make the job.
Yeah, that's not too bad. I think we'll bring the wheelchair in and get you out on that. I wouldn't want to push your luck.
Whatever you advise.
I'll see how he goes walking, unless you got the stair chair.
Oh, I haven't got it yet.
Yeah, I'll see how he goes.
Also, I would get the bed out to here and then stair chair to there if you wanted to.
Yeah, do you want to do that?
Yeah.
Yeah. He just looks like brittle.
Sounds good.
Cool, thanks.
I really feel for particularly couples where they've been married for decades and decades and they need each other. So when we come in the middle of the night and we take one of them away, it must be a really scary thing.
All right, Joe, do you want to give it a crack, see how we go walking?
It's really important to be able to empathise with their situation. Your chariot awaits you, sir.
Where are you?
You right here? I'm right.
I love seeing elderly couples that still have a spark between them.
Okay, darling.
David's due
Don't ring
shortly.
me.
David's
Get them
due
to ring
shortly.
me, please.
Yeah, I will.
Please.
Yeah.
It's a really special thing to see a relationship so close and that's lasted such a long time. It's something to aim for, and I hope that I'll be lucky enough to have that as well.
In the heart, that is.
Very good.
That's it. Yep, how do you feel?
I feel safe.
Good. Oh, good. I haven't started driving yet. You might change your answer.
Oh.
This is very sweet.
Isn't it?
Okay, dear.
Right.
God bless.
Yeah.
And have you and Aileen lived in this house for a very long time?
50 years.
50 years? Oh, gosh, that's a long time.
We had that many move around.
Yeah.
And when we finally settled there, I said, I'm not doing that.
You never moved again?
I think the elderly population were raised in a time where you were stoic and life-saving resources were really scarce and they were taught not to draw on it without good reason. So they tend to leave things until they're a bit out of hand to ask for help. Hello, young man.
That's stranger.
And we're always trying to reassure them that they've done the right thing. And would you like a warm blanket, Joe?
No.
Well, you're right. Oh, you've got a fever, haven't you? Best not give you one. Encourage them to call early on so that we can fix problems early and they're more likely to continue living independently or in the situation that they want to be in.